Good morning, everyone. It's a pleasure to be here with you. Before I introduce myself, I want to thank our housing, dining, and hospitality team who prepared the breakfast and coffee and treats for us this morning, and to thank our maintenance teams for getting this facility ready for today's important event. For those of you that I haven't met, my name is Allison Satterlin, she, her, hers. I serve as Vice Chancellor Student Affairs and Campus Life, and I'm here representing Chancellor Khosla, who had an unexpected event this morning and couldn't be here with you. So I bring his warmest welcome. And it's an honor to join you on behalf of the work that Senator Blakespear's been spearheading in San Diego. And I want to thank her for bringing us together for the second annual Ending Homelessness Summit. So thank you so very much. Chancellor Khosla expresses his deepest gratitude as well. As we gather here today, we're all reminded of the critical role that collaboration plays in really driving meaningful change. And I'm honored and thrilled to see so many stakeholders from across our community coming together to share their expertise, their resources, and their knowledge today. At UC San Diego, we strive to be a force for good in our community, and addressing homelessness is a critical part of that mission. Through our Homelessness Hub in the School of Social Sciences, we are providing high-quality research and analysis focused on homelessness, studying its effects, and identifying solutions that can be implemented in our community and beyond. But we are not just stopping at research. We are also taking action to address the chronic housing shortage that affects not just our students and our staff, but the broader community as well. UC San Diego is currently the third largest provider of on-campus housing in the country. We currently offer a 2-year housing guarantee, and we're on track to become the single largest on-campus provider by 2025, with our intention of offering a 4-year housing guarantee in the future. Construction for 3 new housing neighborhoods is underway and will add 5,700 new beds to our campus by next year. And with our newest project, the Pepper Canyon East neighborhood, which the UC Board of Regents approved last week, we will also add about 6,000 more beds to our growing housing community. Together, all of these projects are moving us closer to our ultimate goal of offering students a 4-year housing guarantee. And they solidify UC San Diego's position as a large housing developer in San Diego County. These efforts are critical because we know that housing is a fundamental component of addressing homelessness. Health is also a significant component of addressing this critical issue. UC San Diego Health remains the top-ranked health system in San Diego County and is committed to delivering exceptional care for all. The health system serves as a critical safety net provider, offering extensive clinical services to unsheltered patients at our Hillcrest and our East Campus emergency departments. UC San Diego Health's community psychiatry program is an academic hub for mental health professionals, delivering direct care to our unhoused community and advancing regional behavioral health workforce development. In 2021, this program received a HRSA grant to fund a 12-month fellowship program providing care to underserved adults, including the unsheltered population across San Diego County. These initiatives underscore UC San Diego's leadership and partnership in addressing the needs of homeless patients with serious mental health and substance abuse disorders, and we know that we cannot do this alone. We need collaboration and partnership to develop comprehensive solutions to homelessness. We need to work together to leverage our collective expertise, resources, and knowledge to make a meaningful impact. And this summit is a critical first step in that process. Chancellor Khosla and our community encourage all of you to leave here today with new partnerships, clear and practical steps that we can take together in our respective roles to make a difference. Whether it's through policy changes, innovative programs, or community-based initiatives, we all have a role to play in addressing homelessness. As we work together to address this critical issue, again, all of us at UC San Diego are optimistic and confident in our collective ability to make a lasting positive impact. Thank you again to Senator Blakespear and to all of you for your dedication and participation in this summit. Now it's my pleasure to introduce our host, Senator Catherine Blakespear. Senator Blakespear has been a tireless advocate for addressing homelessness in our region and UC San Diego is grateful for her leadership and vision. Please join me in welcoming Senator Blakespear to the mic.
Well, thank you very much for the introduction, Vice Chancellor. I very much appreciate being here at UCSD. Thank you for welcoming us, and thank you to all of you for coming. My name is Catherine Blakespear. I'm the state senator who represents UCSD as well as large parts of the coast in San Diego County and then all the way into Orange County. So my district is 1 million people in both counties. I come from having been the mayor of the city of Encinitas for 6 years. So I was in local government a total of 8 years, and now I'm in my 2nd year in the state Senate. And homelessness has been a top problem that entire time, but it has gotten exponentially worse every year. So I'm hosting here my 2nd annual Ending Homelessness Summit because this is such an important issue, and I want to bring together thought leaders. I want to address what is happening right now on the ground. I want us to focus on accountability. There was recently a state audit that looked at the city of San Diego, the city of San Jose, and the state, and broadly said that we are not tracking outcomes well enough. We are not looking at what money is going to homelessness and what is the result of that money. So that is will be the topic of panel number 2 that we are talking about today. There are a couple of housekeeping things I just want to make sure that you all are aware of. As people come in, please welcome them to sit next to you. If we want everyone to feel like they have a seat here, of course we have a few seats available, so invite them to sit down next to you. We have restrooms just outside the auditorium doors, and we also have refreshments in the courtyard. We'll be taking a 10-minute break between each panel, and I have several staff who are here to help you with anything that you might need. So I would like this summit to be fun and participatory, and you can submit questions to each of the panels by clicking on the links that we have right down here. So the virtual panel can be accessed at the QR code right here. And we'll be having a poll, an opinion poll, before each panel that's relevant to that panel. So this is the first one right here, and if you take your phone and scan your response right there, you can submit an answer to that question, and we will be displaying the results. And then also, I'm very interested in your homelessness and housing bill ideas. So please submit them to my office. You can do that here at the summit. We will also take questions from the audience, and if you would like to write them down on a note card, just raise your hand and someone in my staff will come around and give you a note card so you can write it down. You can submit a bill idea that way or a question that way. And you can always, of course, call my office, email my office. I'm very interested in bill ideas that come directly from constituents, and I actually have one that was just signed by the governor just this week that came from a constituent. And it was about being able to breastfeed in court proceedings and be able to ask for a break without having to talk about why you needed that break in the court. It came from a constituent who was a lawyer who was experiencing that, and she submitted it to my office, and now it's a signed bill. So I'm very proud of that. So I want to just focus a little bit on the realities of homelessness. So we know that there is good work being done. A lot of it is being done by a lot of you in this room. People are being helped. But we also know that for 27 months in a row, which is more than 2 years, the inflow of unhoused folks has outpaced the outflow. So more people are falling into homelessness every month than are getting housed. And so what that means, of course, is it's the boat that has the leak, right? You're bailing out the water, but meanwhile, the boat continues to fill with water because it's happening faster than we're able to bail it out. So there's a tremendous amount of attention, funding, and energy being spent right now on homelessness. It's at the state level, it's at the county level, it's at the city level. But the question is, what is the progress? Is it working? Are we able to see improvements? We need to be able to continually adjust our resources and also our focus on what are the solutions that need to change in order for us to see the progress we want. The bottom line is that the efforts to combat homelessness are just currently not sufficient. So some of the numbers, many of you know these numbers or have heard them before, but I think they really bear repeating because it really grounds our discussion. So the Regional Task Force on Homelessness reported last week that in June, 1,172 people became homeless for the first time. 1,172. Most people becoming homeless for the first time, that's an economic driver. It's a job loss. It's something that is their rent going up. It's a combination of medical bills, various factors. It's economic driver that leads people to become homeless for the first time. We had 1,100 falling into homeless, 989 people exited homelessness. In Orange County, the most recent point-in-time count demonstrates a 28% increase in total homelessness in just 2 years, from 2022 to 2024. During the count, 2 shelters in Orange County were evaluated, and it was found that 400 people who were ready to leave the shelter, so their paperwork was ready to go, only 1 out of the 12 were matched to housing. Statewide, more than 180,000 people are experiencing homelessness, which is up 6% from the previous point-in-time count. And we know that this is a significant undercount. The point-in-time count is really important because it happens every year, and it is the number we have, but we know it's also an undercount. And so these numbers help us to ground our discussion today. And our panelists today will cover several different topics. The first one is addressing healthcare needs for people experiencing homelessness, panel number 1. Panel number 2 is insights on the recent state audit of homelessness programs. We have representatives from the 2 cities, San Jose and San Diego, and also from the state on that panel. I'm moderating that panel. And the third one is efficient resource allocation with Mayor Todd Gloria and Assemblymember Chris Ward, who was previously on the San Diego City Council. And that one is at 11 a.m. So I want to take a moment to recognize that there are many important people in this room, some elected, some CEOs, people doing really important on-the-ground work. I'm not going to name all of you in the interest of time, but I just want to say I'm really grateful you're here. So thank you so much for coming. And with that, I would like to invite up Lisa Halverstad from Voice of San Diego. She is going to be moderating the first panel, so I will hand the mic over to her. Thank you.
Thank you, and good morning, everyone. If you aren't familiar with Voice of San Diego, we're a nonprofit investigative news outlet, and I have been lucky enough to spend years reporting on homelessness, behavioral health, and homelessness and healthcare in that intersection. So I'm very excited to be here this morning. With that, I will introduce our panelists. Luke Bergman, Behavioral Health Services Director for San Diego County. Kelly Bruno Nelson, Executive Director for Medi-Cal and Cal-AIM at Orange County insurer Cal Optima. And finally, Glenn Sang, Policy Advisor on Housing and Homelessness for the California Department of Healthcare Services. Now, before we get started, I wanted to give a little bit of a primer. I recognize a lot of the faces in this audience. I know many of you are very smart, but Cal-AIM in particular has a way of just going over a lot of folks' heads, and we're going to talk about that today. So want to get you up to speed for this conversation. So Cal-AIM, if you're not familiar with it, or if you just need a little bit of a refresher, is Medi-Cal reform happening at the state level. That is meant in part to proactively link patients whose lives complicate their health conditions, both physical and behavioral, with services and case management to help them stabilize. And on the homelessness side, there are established community supports that insurers can offer to recipients, including recuperative care. And on the behavioral health side, Cal-AIM is focused on bolstering coordination of care, streamlining documentation, and Luke's favorite, instituting a reimbursement system more similar to the physical health system. So important to know, San Diego County and Orange County both have more than 950,000 people enrolled in Medi-Cal. Pretty big number. And in Orange County, 267 people in the latest quarterly data accessed recuperative care. By comparison, only two insurers in San Diego County got 50 people into recuperative care using Medi-Cal services. And you can also see a pretty dramatic difference in the implementation when it comes to housing assistance and also things like medically tailored meals, which are also community support. So Orange County is a bit further along, and so we're going to talk about the differences between San Diego and Orange County, but I just wanted to set the scene for you all a bit and give that context. So to start, I guess I'll maybe first go to Glenn to talk about this. Can you provide a brief description of how California is implementing Cal-AIM and how far you feel the state is in the implementation process.
Thank you, Lisa. Sorry, making sure my mic works here. I think the first thing I would say is when it comes to CalAIM implementation, we are halfway through year 3 of what we deemed an ambitious 5-year implementation plan. The first 2 years, we really focused our energy and efforts on helping our plans build out the infrastructure and capacity to support new efforts such as community supports that Lisa had mentioned. These community supports, I do want to emphasize that they are optional at the plan's election. So we saw plans picking them up at different times throughout the year. I'm happy to report that what we deem our housing trio is offered by every plan in every county right now. The housing trio is 1, housing navigation and sustaining services. Housing navigation and transitioning services. 2, housing deposits, which covers those one-time move-in costs. And 3, housing tenancy and sustaining services. So when we do get a member housed, how are we supporting them to maintain their housing? How are we supporting them to acclimate from moving into from the street to an apartment unit, for example? So those are some of the services that we're providing. And I'll say more broadly as a department, we've really been leaning into what we deem social drivers of health. So with CalAIM, it's really what I describe as more strategic uses of Medi-Cal dollars and how we're addressing our members' health needs. So when I say social drivers of health, I'm talking about housing. Housing, I think, can be a pretty incredible social driver of health because, example I give usually is, if you have a member living on the streets, diabetic, how are we reasonably expecting them to keep up with their insulin if they don't have housing and don't have like a refrigerator to store that insulin? So looking at those things and what are more upstream interventions that we're putting out there to better meet the needs of our members. So I would say, year 3, we're really moving along, doubling down on our efforts and really making Medi-Cal a strong player in the homelessness space. Also want to just really emphasize too that, we're a strong player, strong partner, but we're not the only solution to this. So really also helping our plans, our counties, our CBOs on the ground, providers, how are we all just embedding, integrating, and really building across silos and integrating our systems and really reimagining how we're meeting the needs of our members.
And clearly from the numbers I shared, it seems that Orange County is a little bit further ahead in terms of implementation, and there are some reasons for that. But Kelly, would you like to talk about how the implementation process is working in Orange County and why you think Orange County might be a bit further along in that process?
Be happy to. So I don't really consider myself to be a health plan person. I'm a social worker. I ran nonprofits my whole professional career. So I often laugh and say to myself, like when I came to work at a health plan, I almost started to I came to the dark side, right? I came to work for the other side, the other team. But California operationalizing CalAIM is exactly where a social worker belongs in a health plan. And I think one of the main reasons that Orange County has done so well is because they recognized they got the assignment, they understood the assignment, right? They said, we need to morph our health plan to become a plan that provides social benefits. And who better to do that than somebody who's run those social programs? Our ability to implement CalAIM is 100% dependent on the relationships that we have with the providers in our community. CalOptima Health does not provide any services directly. We have to build relationships with the folks in our community. And who best to do that than folks like me that used to run those programs myself. So I think that's what we did. So from the beginning, it was all about relationship building. So for example, our network of providers in Orange County for CalAIM is almost 200 providers. A lot of health plans have way less than that. But we understand and recognize that we have to invest in the providers in order to get those numbers. So I think from the beginning, Orange County went at it from a different perspective. We trusted our providers. We decided, this is going to sound, I don't want this to sound bad, but if we implement medically tailored meals and we don't do it exactly perfectly, what's the worst thing that's going to happen? We feed somebody. That's not a bad thing, right? So we went at it from that perspective, saying we're going to go out there, we're going to spread this out, we're going to trust our providers, we're going to build relationships, and we're going to help folks. And then if we have to draw things back and make adjustments as we go, we will. But the outcomes have been better. I think the relationships are strong, and I think we have a network of providers that trust us, that see us as a partner, and I think that's where our success lies.
And Luke, I know we're putting you on the spot a bit because this is broader than just the behavioral health scope that you look at, but what would you say have been the challenges for San Diego County? I will proactively note, too, that CalOptima is one of just 2 health plans in Orange County, and San Diego has several health plans. So I'll start with that.
Sure, and just noting, like, being on the spot is my favorite place to be, so happy to be here. So what you're alluding to is that San Diego County has geographic managed care, that we've got, a multiplicity of plans that hold Medi-Cal products, and so that can create challenges with implementation at sort of at the payer level, right? Because different plans will implement things with different terms. That then cascades to, and in kind of multiplying ways, with challenges at the provider level, because then providers are put in positions where they need to sort of implement things differently depending on the, like, whose member they're providing care for. So geographic managed care creates some challenges that I think Orange County is in the fortunate position not to have to address. I mean, I would note that there are structural challenges with the relationship of behavioral health care payment that are consistent in Orange County and in San Diego County and in every other county across the state of California, and it's probably worth talking a little bit about those. And then I guess I would also say that, that for those of you who don't know, I used to work in New York City, and New York City had, I was AVP over behavioral health at the public hospital system in New York. 13 managed care plans held Medi-Cal, or rather Medicaid products in New York. And so that would present, one would suppose, a much more significant, kind of challenge in creating consistency. And so here I'll sort of nudge and wink towards Glenn. What made things more manageable in New York City was that the state authority was very strong in creating model contracts and in holding plans to the terms of those contracts. So consistency was achieved even across a more complex payer landscape in a place like New York City, because New York State has a very, very strong state authority. The legislature, just to say, is our host here. I don't see her, but the legislature in New York State is much less involved in making kind of detailed regulation in New York than in California. And so it's a challenge, certainly. I would just note it's a challenge that I could be differently managed, I think, if different players approached that complexity in somewhat different ways.
So Glenn, I think that might bear a response from you. I am aware, and I'll just to give context and put a person here, because I think sometimes talking about a person's story helps us understand. I spent months looking at homeless hospital patients and the issues that they're dealing with. And one thing that kept coming up was just hiccups between the different plans, social workers at the hospital not really understanding how do we quickly transition this person to recuperative care. Sometimes I'd be talking repeatedly to somebody who was in and out of the hospital, and when I tried to talk in terms they would understand about community supports, they clearly had not been talked to about those things, or if they had, they didn't actually get connected to that thing. And I know the state has been doing some work to try to rectify some of those issues. So just wanted to give a primer again. Glenn, would you like to respond and kind of touch on some of those issues I brought up?
Yeah, no, absolutely. It's I wouldn't disagree whatsoever. Like, I fully understand that there's still gaps in the services. There's still a lot of what I call going back and putting meat on the bone when it comes to community supports and how we're rolling out services. And, I hesitate a little bit because, I always try to keep the end user in mind. I have this belief that, if we're, fragmented at the state, if we're fragmented in our systems, then what does that look like for delivery of services to like our members? That said, as I mentioned earlier, we are in year 3 of community supports. And the framework for which we were able to provide this menu of services, through our federal authorities, it's in lieu of service, for example. So part of that framework and how we got authority is the fact that, like, under this premise where, hey, if we go upstream and we start delivering like housing deposits, helping with housing navigation, then that can serve as more of a preventative measure for a member having to get treatment in an emergency department, for example. Going back to your example with recuperative care, that one I know is not offered by all plans in all counties yet. I know that there is, it's funny you bring it up because I was just having a conversation about intersections with recuperative care and behavioral health with some colleagues of mine, and I anecdotally, there are some promising practices and models that are starting to arise as systems start to sophisticate more, and we start seeing plans and partners really build those relationships that Kelly had mentioned and figure out how to do these things. So you might have like a substance use disorder residential treatment facility start saying like, hey, yeah, we do want to provide recuperative care. But what does the staffing look like? How do we do that? In areas like San Diego with several plans, how do we build consensus? And, it really goes back to like how Kelly had mentioned, and I'm so glad you came to the dark side. And it's just those relationships and building the consensus, building these programs. And we're starting to see that. And I'm hopeful that those will there'll be more to come. I'm always just focused on like, hey, we have this 5-year implementation ahead of us right now. And the way in the construct that we're doing it, it does take time, but I say that very delicately because I also am very sensitive to the end user and how we're delivering services.
Can I speak to I have a very unique space because, ironically, the nonprofit that I ran for 15 years before I went to the dark side was a recuperative care provider. So I've literally been on both sides of the recuperative care issue, or opportunity is what I would say. And so what Orange County did, so I was on the side of having the amazing opportunity of health plans to pay for recuperative care, but still not being able to fill my facility because there were barriers in place. And the whole concept of recuperative care is to get the individual out of the hospital because it costs more to keep them in the hospital, of course, than to put them in recuperative care. So what Orange County did and how we've been able to get our numbers up, we did 2 things. One is we invested in recuperative care providers, and we actually opened more facilities. We actually used some of our HHIP dollars, which the HCS gave us. We earned those incentive dollars, and we invested those in literally helping providers buy facilities to increase capacity. That was one thing that we've done, and we've opened 3 additional recuperative care facilities with those dollars. The other thing that we did is that we did presumptive eligibility. Every individual that's in the hospital is eligible for recuperative care for the first 30 days. They're automatically eligible. We approve that no matter what. So there's no barrier at the hospital level to get that individual in. Now, if the individual needs more than 30 days, then they have to go through our approval process. But we automatically approve the first 30 days. So there is no excuse for recuperative care not to take an individual. Now, we still have to work with the recuperative cares to help define who's eligible, who's not eligible, right? And there's always massaging to be done, but we got rid of those 2 barriers. 1, do we have capacity? And 2, we can't get them in because the health plan doesn't respond to us fast enough. Those 2 things are off the table. We have more barriers to work on, but those 2 are gone. So DHCS, it's nice to have everything very regulated, and I do get that. And I would say it's also lovely to have a partner that allows you to be flexible and creative, and that they have done that. They've allowed us to be flexible. I could talk about all these things they've done right in front of Glenn, and that, and it's not the same way that things have happened in other plans. And he's going to nod, and he said that's great because they encourage that level of flexibility, and I think that helps.
Luke had something to say.
I guess, I mean, I have a sort of question back, which is like, has the state considered, or is the state moving towards mandating presumptive eligibility for recuperative care for all plans?
I'd say it's something that we're looking at closely. And when I refer back to, like, putting more meat on the bone, it's because when we roll out like these services, when we roll out these policies, like, we really try to go back and listen to our stakeholders and the folks like Kelly and yourself to see, like, what are the barriers that we can remove at the state. We don't make decisions lightly. We want to make sure that our plan partners who we contract out with to provide these services all are in agreement that, hey, this works. And then B, that it's doable and that it meets the needs of our members. So I would say that, we strongly consider these things, and, we're actively listening to those suggestions. So it's not just...
I am making that suggestion.
Well, and I would like to say for a moment, too, to bring it back to the person, I have literally met someone outside of an ER who had been discharged overnight, sleeping with a walker, laying next to him, and his paperwork next to him on an electrical box, who's telling me, I was discharged last night, I was previously in a recuperative care, and I couldn't get back in. And this man was being treated for malnourishment, and he was a 65-year-old man who was very frail and shivering outside. So that's the human impact, if there's not policies that trigger the health insurers to do the things that I think most of us would think make sense to do for somebody who's in that situation, as Edward was. Do you want to talk any more, Glenn, about what steps you are taking to try to ease that transition? Because I've also met many people that I can't help but look at them and think, why did no one think about recuperative care for this person who was in and out of the hospital, literally struggling with a catheter on the street, and nobody at any point said, George, we think you'd be a great candidate for recuperative care. Let's make that happen. And I'm sorry to be, coming right at you here, but I have literally seen the human side of this.
Look, I wouldn't disagree with the issues on the ground, like, whatsoever. Like, I recognize that and fully appreciate it. I think when I talk about, like, building infrastructure and capacity, like, we've really spent the last 2 years, and we're actually going into our third year of one of our initiatives. The last 2 years, we had major incentive programs for our plans. Kelly mentioned our housing and homelessness incentive program, where we did provide extra dollars. There's another one out there that I'll spare the time on, but another one, providing access and transforming health. That also goes out to our providers, the provider community, meaning CBOs, other service providers could go, cities, counties, whoever is contracting with managed care plans. I think I would love nothing more than to have just an array of service providers just contracted up and down California. But the fact of the matter is, like, there's still a lot of work to be done. We still need to build out these networks. That's why it's optional right now. If we make this all, like, mandatory right now, I also have to think about, am I setting up our plan partners for success? So I wholeheartedly agree with the issues, and I'm very sensitive to it. We also need to make sure that when we lean into this framework and when we do it, we have to do it right. And the things that we don't get right, the things that we do need to correct, we do need to go back and listen to things like presumptive eligibility and really look at that. Is this something that removes a barrier for access to care? But I would really just emphasize, like, we're in year 3 and we're really, working with our plans, understanding the issues such as this, listening to anecdotes, and it's not all for naught. Like, we go back and we really try to engage our stakeholders. I think we have plenty of forums. We have regional collaboratives, for example. We have advisory boards with people with lived experience that can tell us these stories, so we can, as a state, look at something and say, like, this is very compelling. We need to make a change here. But then also work with our plans to help build those networks out.
Building capacity is a real thing. Just when Medi-Cal, when DHCS and California decided that these 14 community supports were now going to be reimbursable, it wasn't as if the capacity just magically arrived. And it wasn't as if these nonprofits magically had the skills to do those services, to know how to bill. You know, money doesn't solve everything. You know, money can't buy time, right? And it takes time for nonprofits and these providers to hire the staff, to train the staff. You can't flood a nonprofit. You know, like my nonprofit that I used to run, I mean, we ran 5 recuperative care programs. If Glenn had come up to me and said, Kelly, here's $100 million and I'd like you to open 5 more, I wouldn't have had the capacity to do that. I would have the brains, but not the capacity. So it takes time. So this is a pilot project. You know, it's a demonstration purposely. I think that DHCS has given us, the good news is they've given the health plans the dollars to be able to build that, you know, that infrastructure, but it does take time. I think we're seeing some results, though. I can say in Orange County we certainly are, but it's taken a lot of hand-holding on the side of the health plan to be able to build that capacity in our county to even coach the providers that they can do this, that they're capable of doing this. I mean, there's been a lot of coaching and a lot of encouraging, because it really is taking a field or a provider field that has not been Medi-Cal providers and having them become Medi-Cal providers, and that's a big lift.
I do have to say that one of the issues that I was seeing in San Diego, and this just breaks my heart, is that sometimes beds were actually sitting empty because of the issues with connections from the hospital to the recuperative care facility. And I have to say it was also heartbreaking to the people that were working in those recuperative care facilities. I do want to make a couple brief announcements. One, if you're having issues with connection to internet, please check out the Wi-Fi. And we are going to have time for questions here and shortly here. So if you have a question and you want to submit it in writing, check out that QR code. If you're having trouble doing that, again, the Wi-Fi, I think you'll find to be quite helpful. I want to switch gears a little bit to behavioral health as well, since I know that that's an especially hot topic right now in California. I'm going to try to run through really quickly some of the reforms, just so Luke can focus on the substance here of the discussion. We've had some big changes in the last year or so in California. One, we have the CARE Act, which in the last year established a new court system that allows family members, friends, healthcare providers, law enforcement to petition California courts to order care for people with untreated psychotic disorders. So that's a fairly narrow group of people. It's not specifically a program that's aimed at homeless people, but often in the public discussion, that's been a focal point. We also have conservatorship reform, SB 43, which in San Diego will go into effect January 1st. And that basically expanded conservatorships to include severe substance use disorder and include people whose addiction challenges have threatened their own safety or their access to basic needs such as medical care. And we also have Prop 1, which California voters approved earlier this year. That is a twofold measure. One, it provides behavioral health bond funding for new behavioral health facilities and housing. And it also, importantly, is a major reform measure that broadens the eligibility for State Mental Health Services Act funding to also cover substance use disorder treatment, but puts more of the focus on homeless people and others with the most severe mental health disorder. So how did I do, Luke?
Amazing.
Okay. So Luke, how has San Diego County navigated these reforms as it relates to homeless residents? And what is the county doing to prepare for when it has Prop 1 money hopefully coming down and SB 43 is in place January 1st? Yeah,
I again appreciate your excellent recapitulation of everything that's happened. I would sort of characterize the San Diego County approach as both aggressive and deliberate. San Diego County is, with respect to SB 43, the only county that's going January 1st, 2025. A couple dove right in, but the overwhelming preponderance will be going live with SB 43 in January 1st, 2026. And with respect to SB 43, we have really taken a multidisciplinary, kind of all hands on deck, very thoughtful, very data-driven, very community interactive, I would say, approach, and tried to get as much information and feedback from as many players as possible about what this will look like, sort of on the street, with, I think, particular attention to the role of peace officers. But then also what regulatory and reimbursement work needs to happen at the state level in order to really make what should be the kind of clinical care and social service provision imperatives in SB 43 make sense. Happy to talk about like sort of any details therein that you're interested in. Prop 1, we have also, I think, we just took to our Board of Supervisors a proposal for what county site control initiatives we would want to put in for to get some bond measure funding to support. And we've also established a process for working with community-based organizations to drive applications for bond funding that would come from them forward in as deliberate and collaborative a fashion as possible. So we've gotten approval from our board to move forward with that process as well. Again, happy to talk more or less specifically about that as there's interest. With respect to what happened with MHSA funding as it shifted over to BHSA, so you're right, it does allow for the expenditure of this tax. The tax hasn't changed, right? It is still a 1% tax on personal income of $1 million or more. So it does, the shift to BHSA, and the nomenclature is significant from M, Mental Health Services Act, to B, Behavioral Health Services Act, is meant to signal the inclusion of substance use disorder as an allowable expenditure. The big change, though, is not about substance use disorder. The big change is about pushing it towards non-clinical housing supportive services, right? And in San Diego County, this has been the most significant source of revenue into our Behavioral Health Services Department. It has been primarily, almost exclusively, a driver of core clinical services. Served community treatment programs, crisis stabilization, outpatient clinical services, really like the things that are the core of our work as the mental health and now behavioral health plan for folks with serious mental illness or across the spectrum substance use disorder. That's what MHSA did for us. And we would use the MHSA money that we would get to draw down Medi-Cal dollars, right? So we would take the kind of, $250 to $295, $300 million that we would get in MHSA, and then leverage it for an additional $130 to $150 million in FFP drawdown. The shift towards housing and housing supports that is non-clinical may be wise. It may be prudent. It may be forward thinking. It may be wonderfully progressive. It does present us with some really significant challenges that will require that we approach the sustaining of core clinical services for people with serious mental illness in a very different way. I mean, and in fact, the statutory language, the sort of, kind of preamble in the statutory language in Section 2 of SB 326, which sort of that was the vehicle for the kind of reconfiguration of the tax fund, talks about how, well, insurance is different now. Because insurance is different now, we're in a good position to use this marginal tax mechanism differently, right? The sort of implication being, we have insurance now that will cover behavioral health care proportional to needs. So let's use this special tax to do stuff that insurance isn't doing, i.e. housing, non-clinical stuff, right? Because the public insurance system is necessarily anchored to clinical work. That sounds great as sort of like, as a notion, as a concept. It's kind of consistent with the tenets of the ACA, which the statute, means to refer to. But it's also not true, which is an important thing for us to just like reckon with. Behavioral health services are not covered, actually, in ways proportional to physical healthcare services through insurance systems. They're just not. Access, for all kinds of reasons, continues to be challenging. The whole structure of payer jurisdiction in California, which I referenced before, right, where local governments hold responsibility for serious mental illness. Managed care plans hold payment responsibility for mild to moderate mental illness, right? Means that managed care plans are perversely incentivized against reducing risk of deterioration. Because when folks don't do well, they become the payment responsibility of local government. It's a system that is sort of set up to not kind of use the tenets of managed care in ways that make most sense. And that also, I would say, contributes to some of why the insurance system is not floating things in ways that it really needs to in order to sustain clinical services proportional to need. All of that to say, cool, we've got a tax fund that we are going to, I just saw somebody do a gesture like this. I apologize for all of the technical mumbo-jumbo. I'm happy to dive back into it at any point if you guys are interested. What it means, though, just to say, hopefully this will be kind of a little bit more accessible, is that we got to move money that right now we use for core clinical services into non-clinical work for housing. What are we going to do to sustain the clinical services? Because the insurance system is not doing what it needs to do to fully sustain all of that. So I feel that we are, this is a sentiment very much shared by other behavioral health directors across the state. I would say, somewhat more measured, in fact, in my feelings about this than lots of folks. We are in a situation where we have to do lots and lots more with, in fact, less funding. And what we're going to need to do is not stomp our feet about it and not, sort of like, just cry that it's an injustice. What we need to do is further engage with other payers. And we need to do this hopefully in a way that is kind of as kind of systematic and consistent across counties as possible. So the FQs, FQHCs, federally qualified health centers, are really maximizing what they can do for people with substance use disorder and serious mental illness, so that concerns about the loss of kind of, primary prevention work, right? Like way upstream prevention work. We're concerned about loss of funding for that because this whole component of the Mental Health Services Act, which was called PEI, Prevention and Early Intervention, is going away, right? How can unlikely entities like FQHCs, like mainstream hospitals, participate more robustly in, push more resources into doing that kind of work? And then how do we sort of use this? And this is a thing this is sort of my summative remark about BHSA is how do we, right, the statute references that insurance has changed, so it's time to modernize MHSA. I would say insurance hasn't changed enough, but maybe this proposition will be for all of us compulsion to make the insurance system change. Maybe now we're in a position to actually create the structural changes that haven't yet happened, but that the proposition presupposes would be necessary in order to make this work. I'm hoping that made just a little bit of sense.
So I do want to ask some questions from the audience, since we just have a few moments left here. I'm getting a couple questions about whether DHCS or other entities can facilitate presumptive eligibility for enhanced care management or community supports. And I think importantly, another question being asked here is, how do we address this barrier too of people not even actually being referred for some of these community supports, like recuperative care? And so we don't even go through the process where they are potentially denied for that service. Glenn, maybe you can start, but I'd also like to hear from Luke and Kelly about if there are potential solutions at the health plan or county level to address these as well.
So I think I heard two questions.
There are two questions. I combined. I'm trying to get as many as I can in. So I think with the kind of question being is, how do you address the barriers to people getting these services? What is DHCS doing on presumptive eligibility, and also the referral problem? You've got to be referred to something to get it.
Yeah, I'll start off with presumptive eligibility. I would just be very honest and just say that, we're looking at it, and we have teams that specialize in enhanced care management and are looking at things at the ground level to see like how this is working. So I can't say for certain at this time. That said, that's not meant where I go take it back to our headquarters and it just stays there. You know, when we look at things, and there's plenty of forums to hear this feedback that we take very seriously. The other piece about referrals and authorizations, I guess I would want to learn more about that because that also impacts the plans as well. The plans I talk to, they very much want this to work and figure this out. I think that there are some meaningful learnings that are still happening. I think that over the first 2 years of implementation, especially for those who have ambitiously took on recuperative care as like a community support, they're looking at their models and they're going back and revisiting it as well. So I think to those anecdotes, I would love to hear more about it in the specifics, but I would say that, you know, our plan partners who are working through referrals and the different workflows are very much, what I've seen, very committed, very much at the table, strong partners like Kelly here who are helping me at the state look at like how changes in policy should work and could work.
Luke and Kelly, would you like to weigh in on opportunities you see?
So I think, and this is DHCS's instruction to us, and it's how you implement it. But referrals have to go not just top down, but bottom up. Recuperative care is a little bit of a different thing because it's an immediate thing. You need it right away at the hospital. Clearly, those referrals have to come from the hospital. That's the number one. Although people can go into recuperative care from the street as well. Street medicine programs can refer into recuperative care as well, but primarily it's at the hospital. For the rest of the community supports, though, it's the old school way of doing it is to identify the folks with your fancy analytics of who's eligible for what and give those lists to providers, and those providers reach out. I think a better strategy, or the strategy that we're using that's working for us, is more of the grassroots strategy. Because when you contract with and partner with the organizations that provide the services, that's where the people go. That's where our members are. They're at those 200 organizations that we partner with. They're the ones making those referrals. That's how our referrals are up, is because the organizations that we partner with, that's where our members are. So that's how people are getting to the services. Also, and I would add, we have to have a system by which for folks to be able to make a referral. So right now, we have an electronic system, it's CalOptima Connect, where folks can make a referral. So our 200 organizations can also refer to other community supports that their members, that their people that they serve, individuals they serve need, that they may not provide. The next level, and this is the way I describe it to I am not an IT person. Oh, should I stop?
She's a rule follower. We probably should wrap it up. I'm so sorry to have to do that because I have many more questions, and I know you all do too. But I do want to thank our panelists for participating in this kind of tough discussion, right? It's hard to implement these policies, and some of us will be continuing to watch and see what happens next. Thank you so much.
Sorry, I didn't give you a chance to speak on that one.
No, I blathered on quite a lot.
Hey, everybody. Thank you so much for staying for panel number 2. I hope you enjoyed panel number 1, and we're really grateful for the panelists who came from all over, so Orange County, Sacramento, San Diego, to be part of that. So here we are with our panel number 2, and here are the results of our poll. Thank you for participating in it. If you'd like to just take a little read on it. So the next panel is titled Audit Insights, Program Effectiveness and Accountability. So this panel will investigate the findings from the recent California State Auditor report on the effectiveness of homelessness activities in California and in 2 specific cities, San Diego and San Jose. The Joint Legislative Audit Committee, which is a committee that I am on in Sacramento, in 2003, last year, requested an audit of the state's homelessness funding to monitor the cost effectiveness of the spending. California has spent $24 billion on homelessness in the past 5 years. I just want to repeat that huge number, $24 billion on homelessness in the past 5 years. But as we've talked about, the homelessness continues to rise, not go down. So the purpose of the audit was to evaluate the effectiveness of the programs that are aimed at reducing homelessness. So as you likely know, the state allocates money to cities and counties, sometimes directly to nonprofits. And then the cities and counties, they also have their own internal programs, and then they have nonprofits that work for them. So the issue of what is the state doing to monitor, and then what are the cities doing to monitor that money, that's what this audit was focused on. So in both cities, the audit claimed that 85% of placements are into temporary housing. And as a result, about 40% of people leaving those placements end up back on the street. So it's that revolving door of going into shelters or into safe camping, safe parking, into hospitals, into jails, and then back onto the street. That's one of the major problems that we see with homelessness. Today, I'm so excited and thrilled that we have representation from the city of San Jose. So Omar Passons is the deputy city manager for the city of San Jose. You want to raise your hand? And he is an incredible example of what working with tenacity looks like. So he leads a team of incredibly motivated individuals and brings a wealth of experience to this discussion. He was also the first person to serve as the director of the County of San Diego's Health and Human Services Agency Office of Homelessness Solutions. So he's worked in both San Diego County and in San Jose, the two cities that face the audit. And we also have Lisa Jones, the president and CEO of the San Diego Housing Commission. Raise your hand. They can all see you behind here too. And then unfortunately we are not going to have Megan Marshall, who is right behind you on this slide right here. We are going to have Tamara Kohler. So she is the CEO of the Regional Task Force on Homelessness for San Diego. We're so happy to have you here, Tamara, with us. Thank you. So a couple things that I was reviewing the audit in preparation for this panel, and there are several things that were stated explicitly by the audit. So one of them was that San Jose and San Diego will need to develop additional interim and permanent housing, and that neither city has long-term plans to do that. So having a plan for the permanent housing, that is actually one of the hardest parts because it's very expensive. It's an ongoing funding support is needed, and it's very hard to cite. I feel like citing is one of the underappreciated biggest barriers because no community wants to have homeless serving housing of any type in their community. So when you start to look at a very large city like San Diego, 7th largest in the entire nation, and it's hard to find places to put shelter, that's why you end up with a proposal for a 1,000-bed shelter, is because that is somewhere where it could be. And recognizing the difficulty with citing, when we accept that, I think that will help us forward the conversation. So that's one of the things. They'll need to develop additional interim and permanent housing and don't have plans to do that. Both cities have a fragmented reporting approach that does not track and report in one location all of the funding and specifics related to homelessness. And I know from coming from a city myself why this is that there are many programs like Beautify SJ and similar type ones in San Diego where multiple things are happening at the same time. So there might be graffiti removal, and there's trash cleanup, and there's also homeless encampment abatement. All of it's happening at the same place. Maybe there's a public art project going on. So it depends on how a city is tracking those things. Is that homeless related, or is that more of a litter issue? So some of it really has to do with making sure things are tracked. And then both cities have not consistently monitored and evaluated external providers. This is such as nonprofits for effective use of funds. And so, the reality is a lot of the services that are taking place on the ground are from nonprofits, and we need to be evaluating those as well. And then the last thing I'll just mention before going to the question in the panelists is that the goals can create unintended adverse behaviors from service providers to meet goals. So this is an explanation of why are we not having goals. So the statement was that these unintended adverse behaviors can lead to performance metrics that basically, let me summarize the sentence in the audit. It's that reporting only can be more effective than driving toward goals that service providers find hard to meet, and then they do other things to try to meet the goals that really aren't in line with what what is desired. So I invite you to address that as well, what specifically on the ground you see and related to that. So I think I'm going to go ahead and start with Omar, because he has worked in both of the cities, and ask, what is it that you see working in one city or another? What do you think has been successful, that you think the other city could learn from? What do you think was useful from the audit that you were able to take back to your city because of what the questions the audit has asked you to answer?
Yeah. So first I want to make sure, it sounds like it's on, actually, so that's good. Thanks for inviting me to be here. There's a lot to say, and I'm going to try to be mindful and thoughtful about it. I will start by saying the challenge sometimes with the audit, and this is the lone time, hopefully, over the course of any remark I make that will might sound a little bit, a little pushback, but I want to be clear as I move into your answers to your question. The first is, the County of Santa Clara and the City of San Jose have a 5-year regional community plan that has led to the permanent housing of over 20,000 people. I think the auditors, the sort of folks actually doing the audit were not sort of professional auditors generally. They were like very intelligent, smart staffers of varying ranges. And so having the sort of conversation about these nuances sometimes was a little bit hard to land, but those are the numbers, like roughly 20,000 folks permanently housed. And I will say this as I switch into answering the question. If we think about the goals of a temporary place to live, we need to think about it in terms of what do you hear your neighbors say, right? People need not just a safe, thoughtful, trauma-informed, trauma-responsive place to lay their head, but as a community, right? Cities have this obligation as it relates to what our overall community looks like. And so what that means is one of the outcomes and important aspects of a temporary place to live is what's happening for that person in their journey into permanence. But we're, as cities, right, and counties and unincorporated areas, we're also trying to deal with managing the crisis on the street. And so getting somebody off the street into one of these locations is also an important metric. I will say, so it's not necessarily just about did they get to permanence. But now to the meat of your question, Senator. I would say this. There are two things that I saw in San Diego County that I think are potential values in San Jose. One, the county actually partnered with business improvement districts. This is a very grassroots solution. Business improvement districts, they are self-funding needs in our actual neighborhoods. They partnered with the County of San Diego to say, hey, look, we have a homeless outreach need. We know there's not enough money. We're going to pull from our business district and fund local connection. And then the County of San Diego, I'm not sure if they're still doing this, but then we actually would have people go out to the community and help people get enrolled and connected to service. That's an important model that can be taken up. In terms of the reverse, I think the biggest thing that I would say, and I say this, I have friends on our city council here in San Diego. I've known them long before they were council members. None of them were in that job when I say what I'm about to say, which is I think that the doing hard things, having the political courage and the professional courage as staff to do the hard things is something that I think that San Diego could stand to really lean into on a variety of fronts. I sat in a room when I first got to San Jose, and there were 600 screaming people at our council members saying, don't you dare cite that in our neighborhood, to your point earlier. And the reality, and this is where I'll stop, is they listened. I had went out and listened in the community multiple times over, and they said, we're sorry, the crisis is too great, we're going to do it anyway. And I think we need to not let great be the enemy of the good and try to move forward.
Thank you for saying that. And I'll just mention, here in San Diego County, there was a $10 million grant for 150 tiny homes that the county did not say yes to. And there was pushback from community members, but the reality is that's 150 tiny homes and $10 million that's not coming to this city and this county because of that decision making by political leadership. I think it's really important that we also we consider the structure of things. If political leadership can give the staff under them the authority to make decisions, to say, go out and evaluate all the sites and come back to us, and not have it be a discretionary approval process that leads to endless amounts of analysis paralysis and hand-wringing about it. We need to move forward to the solutions to say yes faster. And we currently are not set up to do that as well as we should. So I appreciate you really highlighting that, and you noticed it got the first applause from the crowd of the day. Okay, so now we'll go to Lisa Jones, the president and CEO of the San Diego Housing Commission. And the San Diego Housing Commission is San Diego's public housing agency and is a leading partner in addressing homelessness in the city of San Diego. Lisa has more than 18 years of experience in affordable housing and homelessness program implementation, and we are thrilled to have you today. Thank you. Are there findings from the audit that you found useful for San Diego specifically?
So there are findings that are useful, and there are findings that need to be contextualized, right? And one of the challenges we talked about just a few minutes ago that you talked about was the need for development. So the reality is, and we've talked about this, the City of San Diego does not have a dedicated funding stream to address homelessness or affordable housing development. So when we are using, frankly, a lot of our HAP and state dollars, which we're deeply grateful for, to deal with immediate crisis response, which is essentially shelter. So a lot of the money that we're spending in state HAP funds is shelter and outreach, so that we are trying to address the humanitarian crisis on our streets. What that doesn't do is keep people from entering the system in the first place, which is meaning that our inflow numbers are higher than our outflow numbers. And what it also doesn't do is create long-term housing options so that we don't warehouse people in shelter, but we find them a place to go. Without a local revenue stream, that is one of the biggest challenges that we will continue to face as a city and a region. And it's one of the things that is really hampering our efforts. So when you look at performance and you look at how a shelter provider is performing, and I want to speak to you, specifically asked us to speak to this, what happens when we create outcomes that end up with adverse effects? If we create a goal of someone shouldn't spend more than 90 days in shelter, and that provider then thinks that they are going to have their performance dinged for having people that are what are called long stayers, what that means is they get exited out one way or another. What that means is whatever engagement that we have started to try working with them through case management to help them find their own way to exit housing, because the reality is we don't have enough subsidy to help them exit, ends. So the 90 days looks good because they're not staying in shelter, but to your point, they're exiting back into the street. They're not exiting to a permanent housing opportunity. So when we looked at, and we had a lot of conversations with the auditor, and it was really great conversations around reporting only versus setting goals, is you have to be very thoughtful about the goals you set. So goals around positive exits and exiting people to permanent and longer term housing, absolutely. Goals around length of stay, very dangerous and inherently can backfire on us. But when we look at those goals for positive exits, if we're 40,000 units behind in our RHNA numbers for affordable housing across our county, and we're still achieving a 20 to 30% exit rate, positive exit rate in our shelter system, look, it's sad to say that, but that's actually pretty good, right? If you look at RTFH's monthly numbers, where you talk about the number of folks inflowing and the number exiting, on any given month, more than 50% on average of folks exiting out of homelessness into some form of housing are doing so without a permanent resource. So one of the conversations we had in April with HUD in DC was that the system is actually performing well, considering the lack of resources. How do we take the data that we got from the audit and start contextualizing it so that we make sure that the framework around this crisis response system is also growing? HomeKey and the work that the state has done in dedicating HomeKey funds has been critical in making that happen. Because without those resources that create those housing opportunities, we are just going to warehouse people. And making sure people are safe and inside is incredibly important. But we're going to just building more and more shelter beds if we don't keep people from falling into the system in the first place and increase our exits out, increase our resources for affordable housing on the other side.
Thank you. Yeah. And if you want to submit a question, make sure you raise your hand and I'll come around with a card. In response to your answer, I just wanted to to add that to me it seems like cities have a really important role in defining their own goals. So there can be nuance. It doesn't have to be someone has to exit in 90 days. It can be like the goal, and I think the audit reflected this because it showed San Jose's goals, it showed the city's goals. And one of the things that I perceive in the homelessness discussion is that a lot of times the report out or the deliverable seems to be very process oriented. So it's something like, we held 5 meetings, or we handed out this many of flyers to homeless people. We did, the idea that we are making progress when we're actually not making progress. The point is, what came out of the meeting? What was it? Handing a homeless person a flyer that says, here are your resources. I think that's universally something that is ineffective at doing really anything, especially when somebody is being contacted, multiple times over multiple weeks with this flyer. So, my hope is, I think it's great to give a flyer to the mayor so that if somebody talks to me, I can say, oh, here's a resource you could call. But the reality of going to an encampment where people are on the grass in front of the library and handing them a flyer, so the point is that let's set goals that are responsive, that are nuanced, that allow for us to be working towards something together that's really outcome driven.
And you make a really good point, which is moving from where we were 5-10 years ago, from sort of, I'm just going to use a really bad example and I apologize, counting widgets to counting outcomes. So rather than just counting, to your point, all of these sort of little tick boxes we did, that spends a lot of time on data reporting that isn't valuable. It's the outcome that's valuable. It's what happens a year and 2 years after that outcome occurred, following that exit to make sure that people remain stably housed. That's what tells us where our best practice needs to go.
Senator, one thing I've got to say, the incentives are so poorly aligned for city and county staff to take the risk to actually hold themselves accountable to an outcome, that's an issue that elected leaders at the local level, at the state level, can work to address. So that if instead of saying how many people were served, which means almost nothing, right, what actually happened, that person, that staff member at BHS or OHS or whatever needs a little bit of cover, needs to know that they're not going to get taken to task if they don't hit the mark. That's a useful change. I just wanted to flag that.
That's a really good point. And actually what it means is, and this is critically important, which is this conversation you're having today really drives that home, is we have to talk about when we're not successful. Mm-hmm. We have to be comfortable with admitting where we've made a mistake, where we need to realign, where we need to figure out how to improve those. If we don't talk about what's not working, then lawmakers can't bring the policy and the resources to bear that we need to be successful.
Thank you. I'd like to invite Tamara to offer any thoughts broadly on what we're talking about here or on the audit.
Well, thank you. And thank you for the invitation. Many of you know me, and this is the space that we're comfortable in. And I represent the continuum of care. There are 44 of them across the state of California that also received funding. And I think one of the things in the audit that was a bit of a challenge is if you only look at a city, you miss the forest through the trees in a lot of ways, because we coordinate a lot of this funding. And so continuums of care receiving this funding, and also I think missing in the audit was the context that this was one-time funding in its original iteration. And so for cities to put that money into housing, which means a long-term investment, was really a challenge. What was their immediate need was reducing the unsheltered in their communities. Things like safe parking lots were funded. Some of this, tiny structures, having outreach teams. The state's original investment of HAP funding, or HEAP funding, which is not the HAP, funds a lot of the outreach that is now there in, engaging with people to connect them in the system, which we didn't have funding for. And so I think part of the challenge in the audit was it looked at just a slice of part of this work and said, hey, cities, you're not achieving the housing outcomes, when in reality their ability to achieve pathways to housing and the coordination of that work is really critical. Because it's not one funding source that gets this work done. In fact, one of the most complicating things is the multiplicity of funding sources that it takes to move someone from not knowing how to connect to the system in a vehicle lost their apartment, to actually knowing that there's safe parking lots that can help you connect to that work. And you might need, as we talked about that first-time homeless, just a little bit of financial assistance. That actually isn't a positive outcome in the audit because it's not carried all the way towards housing because we're not paying for the housing at the end. And so there's advantages and things to really understand in the audit, but we can't take just a look at a city and say, hey, you weren't moving people to housing, because we layered in funding from continuums of care, the effort of the county's, say, street outreach teams. All of that comes together to end someone's homelessness. And I think the importance of really measuring not the widgets, because when you only measure that, you only get their piece of what they delivered instead of the outcomes. And the outcomes can be shared across those funding sources. We can all get credit for someone, and should be, because of the investments. I think also important was the funding came out during the time of a pandemic, and a lot of that funding was safe sheltering. It was critical that people were in safe spaces. And then also the investment that was made into Project Home Key, which started out as Project Room Key, which was sheltering in hotel rooms, turned into housing. And then a significant amount of the state's funding that we received as a continuum of care, or the cities, was actually put into the capital side of that as well. And that doesn't come out in some of the reports, because it's not a number of people that were served. It was an investment in housing to end homelessness. And so there's opportunities in this space, I think, for the state to lean in more intentionally and match some of the measures to actually what the fund was intended for, and because it was one time. Now really wanting us to turn that into housing, I think, is something that both Lisa and Omar are talking about, because housing in and itself as a capital investment can be one time. Long-term supports for people into housing,
ongoing rental assistance is
ongoing is a little bit more challenging. And so I think it's important whenever there's an audit to see what we learned from it, but also what we forgot to measure, or the questions we forgot to ask that I think will be critical in moving that work forward.
Thank you. So this is a question from the audience, and it's and maybe the City of San Diego and City of San Jose can both answer this. Do we have precise measurements as to what percentage of currently homeless people have severe mental health disorders and dependence, so substance abuse, and what percentage are neither and are homeless because they cannot afford rent?
So, I mean, we do collect that. It is, without the ability to necessarily sort of cross-reference behavioral health data, healthcare system data against homelessness response system data. The HMIS system, Homeless Management Information System, does gather general information. So, but it's self-reported. So it's as good as the information that we're getting. So for those providers that are working in the homelessness response space, we can identify generally who reports having a long-term disability, whether it's physical disability, mental health, behavioral health, substance use disorder, co-occurring conditions. That data is captured. It is captured in a sense that it's self-reported by the client. So it also, to a large degree, depends on the level of comfort that folks have in reporting to the person that they're engaging with through case management, also their own level of self-awareness. There's that's involved in that. When we think about folks that are just economically displaced, that's when you start looking at your what's called first-time homelessness numbers. So first-time homelessness numbers, they're showing up in the homeless response system in such a way that they are engaging in someone who's going to enter their information into our database, the regional database, saying that they haven't experienced homelessness before. Oftentimes, you can extrapolate based on income reporting that they may simply be economically displaced.
But Lisa, can we just cut to the bottom line? So there are about 10,000 homeless people in this county. So what percentage are just poor, and what percentage have mental health, drug addiction, other abuse? So
I'm going to go out on a limb and argue that anybody in the homeless system is economically displaced. Right? That's the reality. This is not an affordable place to live. We are one of the most expensive places in the country. Some of the folks that become economically displaced with no mental health or behavioral health or physical health conditions at the start of it certainly can experience them. I would experience them while they are. So Tamara may have better information on this data than I do. I apologize, Senator, because I don't know the exact percentage answer, but I am going to argue that 100% are economically displaced.
This,
Okay. You can write it down. I just want the number. So if someone knows the number, just write it down. Okay, I appreciate the nuance in the answer, but do you want to answer from San Jose?
it's pretty short. I mean, the answer is no. From a precise perspective, we don't have that information. I do think it's worth noting that one of the values of CalAIM that did not get talked about in the last session is the actual push to get the hospital ecosystem and the homeless crisis response system to better match their data. It's something that one of Luke's current staff, Dr. Esposito, was working on before I left, because that will allow that kind of information. The nature of serious mental illness sometimes is such that asking somebody about their condition is not the best way to find out. Having access to that clinical piece is much more valuable. And so there is a bridge there, but no, honestly, we don't have that precise information.
Okay. 54% here. 54%. I don't want you to answer. I just want you to hand me your card.
Yeah, we could have a whole separate conversation about Google and what that means.
The reality, though, of this being a little bit or very unclear, I think, is one of the difficulties the public has with interacting with this topic. Because when we are walking on the streets or we see people who are clearly dying, they have mental illness and drug addiction at this level that we just think, how is it possible this person is living on the street? But, you go out and do the point in time count, which I've done, and you are talking to people who are very middle class and they're living in their car, or they just happen to be sleeping here temporarily. And also the safe parking programs that we have. I see Jewish Family Services here. They do, when I've been to the safe parking programs, a lot of those people, they actually are working and they are economically displaced. And seniors are the largest growing group of homelessness. So those people, their Social Security is not keeping up with rent. So understanding those numbers in the big picture, I think, would really help. Okay, so this is what we have from the note, which is 50%, 45%, which means? Substance use disorder. Okay, so almost 50% substance use disorder. And then 25% mental health problems, and
depression and anxiety, the overwhelming preponderance of those, and Lisa's initial response was the most important, right? The question assumes that the question is about seems to reflect a discussion on cause. Is it economic or is it behavioral health? And the fact is, it's always economic. People with behavioral health conditions may have more challenges with you.
Okay. We're going to get back to the panel who's up here, because you already had a chance, mister. But we do appreciate your expertise, and thank you for staying. Okay. So I wanted to focus in on the audit, because that is the topic here. So based on the dismal audit results, this is from a card as well, that illustrate this spending failure, what strategies are being discussed to make changes? So I wanted to know specifically in San Diego and San Jose, how is data being collected differently? What are we asking nonprofits to do that they weren't doing before? Do we have different systems, data management, IT, personnel, just internally? What has come? The audit came out in April. So here we are a few months later.
Okay, go ahead.
So for us, it's, I think, pretty easy. There were a couple, I didn't answer this the first time, but there were a couple, what I would say, accelerants associated with the audit findings. So one, you mentioned the silos of funding, which if you understand a municipal budget, it makes sense. Like you said, the cleanup budget is here, et cetera, et cetera. The fire budget, the abatement budget. Our budget office, centralized budget office, has actually, in response or sort of contemporaneous with the audit, merge those and clean those in a way that does allow a little bit more direct tracking to that very point you're getting at, because it's so splintered. So the 100 million pounds of bio-waste that gets collected, 100,000 pounds of bio-waste that gets collected, we now have a way to track how that relates to the overall topic. So that's, I think, one thing that we're seeing change. I think the other thing is something that, frankly, it gets to Lisa's point about being willing to be self-critical. I think sometimes government agencies lack humility. And if we're just especially the professional staff side, the electeds have their own, but for professional staff to look in the mirror, for me to say, you know what, I can do this differently. I can do my job in a different way, and it's okay to admit that. And I think that our budget office, our housing department director, many of the people, and it starts from our city manager, my boss, who say, look, it's okay to admit that we didn't get that part right. Right? Changing the incentive so people don't feel ostracized for saying something that is not in step with, whoever it might be. I think that's a change that's important. And this audit, And while I don't know that it's dismal, I do agree that we have seen some changes.
Thank you. Go ahead, Lisa.
Thank you. I mean, I'll be frank, I don't agree that it was dismal either. What I do think that we learned, and we had hundreds of hours of conversations with the auditors, is that we are not doing a good job of demonstrating in a public way how we are performing and providing context to that. We're not doing a good job of communicating that we actually do have a community action plan on homelessness that sets specific housing targets, specific prevention targets, specific shelter targets. All of those things exist, and they are live, and we work them. And there is both an implementation team and a leadership council that is focused on this work. But not only do we have a hard time communicating that to the public, it was even hard to demonstrate that effectively to the auditors. And we spent many, many hours in those conversations. So what we've learned is that when we, and this is often the case with government, I hate to admit, and I even feel uncomfortable referring to myself as government. There we are. It's the CEO job that I'm in now. What we've learned is that we think we're doing a really good job of communicating out to our public and being transparent. We have dashboards that are public facing on our website, and a variety of them. And when we have auditors that are trained in this kind of work and data analysis and are struggling to understand them, then we're sure as hell not getting that information effectively out to the public. So I will be honest, one of the most effective tool experiences we've had in this audit is understanding how we better demonstrate where we are being successful, where we are failing, and where we are focusing our efforts for improvement. Because that didn't come across well in the audit, and I don't think it comes across well to the audience. Though I will argue that my team is probably have some of the most comprehensive monthly, quarterly technical assistance, data collection tools, data assessment, monitoring, annual auditing of any team I've worked in my 20, I'd say, well, it used to be 18, now I'd say it's 20 years. But that's not coming across. So there's work for us to be done.
Thank you. Tamara, did you want to answer this?
Yeah, I think one of the important things is really understanding how the auditors looked at it. What was their lens? And then how do we pivot to really address that? Because the auditor's lens is a critical one because it's the legislative's lens. And it's the things you want us to answer. And I'll just say we failed at answering them in a way that clearly could articulate that we were moving people to exiting homelessness and the importance of all of the segments of the system and how the funding was in there. So I think it really was on all of us in this space to take that audit and not say, hey, everything it didn't capture, but take it as sort of a clarion call to understand how to better demonstrate the work that is happening and also why funding strategies happen the way that they do. And I think that lens is so critical from the legislature. It also didn't reference a lot of the work that and not to speak for Megan, but a lot of the work that was being done at the state level office to really say, here are the things we're seeing, and they started changing reporting and documenting the coordination between cities and counties and continuas. And so that we are getting much closer to that. And so it's also important that the audit looked at a point in time, and we've already made some really critical improvements. But it is important. Look, if you are tested on anything and the test comes out and says you didn't do well, you've got to go back and look at what that meant and do it better.
Thank you. We have a lot of questions, by the way, so I just want to, unfortunately, we're not going to be able to get to all of them. One of them is getting at the question of what changes in state legislation could be effective to help manage this problem better or do better, have better outcomes. And I'll admit that as a second-year legislator who cares deeply about this and thinks about it a lot and has conversations a lot, I have found it very hard to have legislation in this space. Because there just doesn't seem to be a room to move legislatively around the state agencies that have a lot of authority and are managing things on their own, the governor who has a particular positioning, and then, of course, the reality that a lot that is actually happening at the city and county level. So in terms of the legislature, that body of 120 of us, do you see any legislation that you think would help, or otherwise I'll broaden it to say from the state level, what do you think would help? And I would encourage you not to say money. Because I think that we all know that we need more money, and that's one of these questions, is that it's going to take 10 times as much money as we are currently dedicating to solve this. But recognizing money is important, but what else structurally might help or legally?
So I'll start with the answer that nobody likes. Is one of the challenges, and I'm hearing it in your remarks, is that there's not one easy answer that makes all of this easier. Right, and so what you're doing is chipping away at the work. You've supported and pushed forward several Senate bills around Coastal Commission, around ADUs, that are about streamlining the process, right? And those maybe seem like small impacts as standalone items, but the reality is at both a local level, whether it's your city, your county, or whether it's at a state level, we have to look at all of those incremental knobs that we can turn to increase housing production, make it less costly, and make it move faster. And it kind of reflects your remarks about how challenging it is, because it's not one answer. So when we step away from the fact that we need more money, we need more federal vouchers, we have 17,000 vouchers in the city of San Diego. I haven't pulled from the wait list for 2 years. There's 60,000 plus households on that waiting list. The horrible news is that we will not be pulling from that wait list for the next couple of years, and all of the effects that we have had partnering with the state and the county and RTFH around HomeKey were kind of our last hurrah. 600 plus units we brought in through HomeKey. I'm oversubscribed in vouchers, and I don't have any more vouchers to commit to those kinds of resources. So you're right, talking about money isn't going to fix it, but how we can reduce costs in building and bringing supply on, and how we can streamline are those little tiny pieces that we keep moving forward on. So we're very grateful for what you have done. We know it's hard work. We've certainly done a lot, and the mayor has through HAP 2.0 and several of his housing action packages, but there's no one magic bullet on this one.
Yeah.
I can think of 3 specific things. So first, under CalAIM, one of the opportunities exists for health plans to be able to actually pay contractors to stand up recuperative care facilities. In the city of San Jose, we knew they were going to try to do that in our city, so we knocked out some of the planning requirements so that they could do it by right and just move, not have to worry. The state could incentivize cities to do more of that, counties to participate. Sometimes you need a county government to say, well, here's what we mean by recuperative care facility, or whatever it is, right? If it's not defined in state, that one is. But so that's one thing. I think a second one, CEQA and building reform. There's a fair amount of building code reform. There's a fair amount of CEQA reform that's out there. There's a couple of holes. I think you identified one, frankly, that I still think is a good one. That's the environmental law. That there are valid reasons to protect our environment, and there are many, many times that slows projects down. The same is true with building codes, where sometimes it's not that the building code itself is in the way, it's that there's a tension between what the locality is doing and what the state is allowing. And if the state just said, look, here, just get it out of the way, like it did during the pandemic, that would be great. The third thing, in light of Grants Pass, right? Probably everybody in this room knows what that case is, knows that they've criminalized the notion of having a piece of bedding to modestly help yourself not feel the effects of sleeping on the floor. One of the biggest things that I think the state can do, and our mayor came out and said this the day that it came out, is to say, we need the state to not enable often smaller jurisdictions to just criminalize their way, force people into the largest city, and then make that all it's a problem for the unhoused folks, it's a problem for the largest city. So regionalizing that requirement not to let small cities just kind of do that would be a huge help, I think, across the state.
Thank you. Tamara?
I think many people know I did this work at a state level for the state of Utah for almost 9 years. And I think one of the challenges that you have as a legislator is annual budget and doing legislative things 1 year at a time, and it's really incremental. I think one of the lessons learned of this funding that came from the state was, hope it's okay to say, sort of a short-sighted idea of one-time funding every year. You can't build sustainable change with one-time funding every year, but you have an annual budget every year that you have to work within. So that really means, as a state, you've got to sit down and say, what are the outcomes we're really looking for, knowing that we're going to hold this in the budget and we're going to actually build to the housing outcomes. Like, I think that's one of the biggest challenges is one-time funding, and as you know, it's so hard to hold that in a meaningful way to have a really big impact. And so I think from a legislative, when people always ask for more money, that's actually not the solution. It's using the money really intentionally for a period of time to have impact. And changing things every year is part of the challenge that we have, I think, in a lot of ways. If we had had the runway to really look at the state's investment to the cities, the counties, and continuous and said, this is a 8-year funding cycle, that you would have seen a lot more of intentional outcomes. Because we also put this money to a nonprofit, and a nonprofit is going, well, if it's 1 year, how am I going to hire people and train them and then tear this down in a year, right? And I don't want to put people back out on the street. So I think this challenge that you have as a legislature is really how do you get sustainable change with 1 year resets all the time? And that's a challenge to our legislative body, especially in a deficit. But if we had, when we have surplus and opportunities, instead of doing 1 year, do a plan where that funds over time. I can just say in areas and states and cities that have been able to do that with a funding source, they've seen success. You can't do it a year at a time. Those little things just don't get you there.
It's also worth noting, Senator, that the federal government funds 0.5% of its federal budget on rental assistance. So there's no Superman coming from the feds at the moment, right? And we have a 100-gallon problem and a 5-gallon bucket. And I think one of the things, level setting the reality of that difference is something that I think is important for state legislators and their staff and things to really, really understand.
Yes, I appreciate the focus on this. I've actually stood on the floor of the state Senate and said we should have HAP funding be ongoing and we should commit to it in future budgets, because the reality is signing leases, hiring people for 1 year is just not practical. You can't run a program on that. I think fundamentally there's a resistance to thinking that this is going to be an ongoing obligation of the state budget. I think there's a delusion that it's actually going to self-resolve, that we'll be able to, set this up and then things will work out. But some of the questions here are about the larger systemic problems, whether it's a living wage not being able to support actually paying for housing, or it's the real estate industry all designed to have real estate values always going up. And I mean, the reality is we do live in a capitalist economy, and our commitments to having something like social housing or public housing, we collectively do not see that as something that we want to be funding in an ongoing way, and that's why we haven't yet. So I want to say a big thank you to our panelists. This panel needs to conclude, so thank you again for your time.
Can I take this out? All right. Hi, everyone. Welcome to our last panel of the day. My name is Jennifer Nations. I work here at UCSD. I manage a research lab called Homelessness Hub in the Department of Urban Studies and Planning. And we are really delighted to all be here. So we're going to get to shift to more of the political side of the conversation now with our panelists. So I'll just introduce them, although I don't know that they really need big introductions. So we have Assemblymember Chris Ward here. And of course, Assemblymember Ward represents a large portion of the city of San Diego and part of El Cajon, formerly served also on the San Diego City Council. And then, of course, Senator Catherine Blakespear, representing the 38th State Senate District, which is part of North County, including my home, as well as part of South Orange County. And then, of course, was previously mayor of the city of Encinitas, and then Mayor Todd Gloria, mayor of the city of San Diego since 2020. So thank you so much. And this panel is focused primarily on funding. So in some ways, it's going to continue the conversations that we started in panel 2, where we were really drilling into financial accountability. But we're going to talk a little bit more about political pressures and priorities around funding, and how these three think about those issues and navigate these processes. Of course, we can't do any of the work of ending homelessness unless we have the budget to take action and have consistent budgets year to year.
And those budgets are limited and they fluctuate. So we're going to talk a bit also about planning long term, as Tamara brought up at the end of the last panel. But because of some breaking news this morning, we're going to actually bring up a question from the audience first, which is about the executive order from Governor Gavin Newsom. So the question was around, like, how can cities respond to this? What does this mean for our removed citizens? And I'll add to that just a little bit of context if you're not aware. Governor Newsom issued an executive order that instructs state departments to clear encampments according to some guidelines that have already been drawn out by Caltrans, as well as to provide guidance to local governments for how to do that. And of course, bans are very contentious for a number of issues. They do seem to assume that people don't want to go into services. And they do seem to assume that there are services in existence that are accessible. And I think, when you have a higher level of government potentially pressuring it, it assumes that cities are going to be able to respond, that they'll have the fiscal capacity to respond. But then, of course, there are ways in which we've seen some potential benefits to bans in terms of getting people connected to at least medical services. But then, of course, disconnection to medical services. So they're very controversial. So I just want to get your first responses. What do you think cities, local governments can do in response to this executive order? And what do you think, kind of initial picture, what do you think is going to happen next? And we can just start with Mayor Gloria, who has a lot of experience in this.
Sure. I like starting easy. Okay. Thank you for the question, Dr. Nishins, and thank you all for being here. I always love to see audiences like this, not because the size and enormity of this challenge, how do I want to say it? Just, I appreciate people caring, right? I think I'm desperately concerned about compassion fatigue on this issue, and that probably relates back to what the governor's executive order today is about. And so just seeing a room full of folks that care about this issue and want to engage in it meaningfully is fantastic. And thank you, Senator, for creating this opportunity. To answer your question, not much will change at the City of San Diego. I think you all know we have an unsafe camping ordinance that was passed last year. We've been implementing it since. And so we follow a progressive enforcement model where we make multiple contacts with individuals, educate them about the services that are available, and encourage them to utilize them. We did that in tandem with a drastic increase in shelter capacity, largely through 2 safe sleeping sites that have been very successful and very popular with unhoused individuals, where they can get connected to services and care and other resources that hopefully will help them graduate into permanent housing and end their homelessness for good. For the governor's announcement today, my reaction is that, I think it's beneficial to have alignment between what the city is doing and what the state is doing. Some of you certainly see significant encampments along the Caltrans right-of-ways throughout our county. And so that direction probably now makes the cities, the state align with what the city's trying to accomplish, and hopefully reduce the amount of whack-a-mole that happens currently where, folks may jettison between city jurisdiction to state jurisdiction, and hopefully get in alignment so that people are being pointed towards services. What I concern myself about is that I get asked a lot about the unsafe camping ordinance and very little about the safe sleeping, safe parking, and shelter expansions, and certainly very little about our pro-housing policies at the City of San Diego. And I think what is true is that a lot of cities will be happy to engage on the enforcement end of this without engaging on the services and shelter provision, which has made our San Diego model successful. So my hope is that as you leave here today, that you talk to the 17 other mayors in the county of San Diego, most of whom provide 0 shelter in their jurisdictions and have very little to no permanent or supportive housing in their communities, to tell them that they can't, if they want to do enforcement, we certainly understand that. Encampments are unsafe and unsanitary, and they do pose a risk both to unhoused and to housed individuals. However, you can't just simply move them along. They have to go somewhere. And everything I'm doing in the City of San Diego is perfectly replicable in those other jurisdictions if there's the political will to do it.
Thank you. Yes, thank you. So I appreciate what Mayor Gloria said about the 17 other cities, because I come from the city of Encinitas before I was in the state Senate, and we were one of those cities that had absolutely no services for unhoused people. And so I think going back to the original question, I applaud the governor's leadership. So I do not think we should have encampments in our open spaces, our natural spaces, our downtown sidewalks and streets, our parks, and they're unsafe and unsanitary. They're not good for the people who are living in them, and they're not good for the public that wants to use those public spaces. So my philosophy is that there's a right to housing, there's a human right to housing, and there's a corresponding obligation to use it. So those two together, you could say that this obligation to use it, the idea that people cannot live in encampments, that is really the tail of the dog. That's not the dog. And I feel like the tail can actually wag the dog in many ways here. Because if we're saying you cannot camp everywhere, it will drive cities and counties and the state to actually have more housing. And right now we need that, because the hardest thing to do is to site the housing. And it's the housing of all types. It's the behavioral health housing, it's the interim shelters, it's the long-term supportive housing. And so I feel like these things can work in tandem, going together, saying you can't camp and we need more housing, and let's do all of it. So the governor expressing, for example, in the Caltrans right-of-ways, when you see encampments and the air pollution people are breathing and the reality of having no bathroom services and all the things that we know, that is not a place for living. Those places are not suited for human habitation. So to say out loud, we want all the state departments to prohibit this and to find a way to compassionately find other places for people to live, to me, that is really good leadership on the governor's part. And I think cities, like now the city of Encinitas is involved with the city of Vista, and the city is using its general fund money to provide homeless serving beds for people in one shelter together. So it's a cross-jurisdictional, two cities working together, a homeless shelter that did not exist before, and it exists now, and it is serving people. And that kind of thing doesn't happen if you don't have the pressure, the obligation that's being provided by these other decisions. So in summary, I do really applaud the governor's decision today.
Well, thank you. Good morning, everybody. It's great. I'm sure the Senator would agree to be home on summer recess. Really appreciate your leadership to bring us all here together today. We've got certainly our work cut out for us as we finish up this year's agenda by August 31st, but it's been wonderful to see so many San Diegans during this break. And I think that I, would answer the question, again, kind of hot off the press and sort of what I know about it, not having read the actual executive order, with a little more skepticism. And the reason I say that, as the Assembly's housing chair, and for the work that I've done as the chair of the Regional Task Force on the Homeless and working with our Land Use and Housing Commission at the committee at the city, just deeply involved in so many of these issues. The legislature, in some of our budget review this year, was really, really skeptical of the encampment resolution program. And I'm not sure, when I sort of read the write-up about what this executive order would do, that this would, certainly on state departments, be able to accelerate or enhance both the outreach and the requirements, the redirection towards resources, the offer of resources, and the redirection towards storage. All of that is already sort of part of the program that we find with the encampment resolution program today. That program, when we reviewed it in budget subcommittee in February, had a 3% positive success rate towards positive outcomes as we are trying to sort of measure them against best practices. Compare that with some of the other strategies and programs that we're working on to resolve homelessness. Meanwhile, at the time, I know we'll talk more about funding, but we saw, proposals for deep cuts to HAP, to REAP, and to other programs as well. So for my kind of read, again, on first blush with this executive order, I'm not sure that it's necessarily going to change a lot. If anything, again, we'd have to talk through this, but I worry just the opposite of the mayor. I think it might increase whack-a-mole, that we have, yes, the city, kind of thought through carefully, made its decision, and was working on the unsafe camping ordinance on the streets, but we saw at the same time an increase in state lands. Possibly some people rightfully were going to the new services and the programs that the city was providing, and that was great, but some people did move over that line, that jurisdictional line, and we saw increases in encampments there. So now where do they go, right? Until we are building that outflow and we are creating more temporary, permanent, and service-based temporary and permanent housing opportunities, service-based programs, I'm not sure, what that leaves us for options for those who are experiencing homelessness there. Not that we don't need the urgency, and I certainly do appreciate the leadership and the attention on this, but there's a lot more to be studied as far as how the executive order is actually going to implement, and if it's anything like the encampment resolution, I'm just suspicious.
Thank you. We'll definitely have to wait and see, but I think that bigger question about where people go, right? And so Mayor Gloria's attention to making spaces for people to go, there is an answer there, but right, when we get kind of the enforcement stick without the place to go carrot, it's a big time lag between passing an encampment ban and then actually having the housing built. So, what are we doing in that interim? And so I think really I'm going to segue from that into one of our big sources of state funding. And this was brought up in the last panel, which is our, the HAP funding. So I'm going to spell it out for everybody. Homeless Housing Assistance and Prevention funding that we've had in place for several years now. But of course, big cities like the city of San Diego apply directly for this. Smaller cities benefit through the continuum of care in applying for this funding. But like so many other things in our state budget, we have good years where the funding comes through and then a year where it's threatened. So we already spoke a little bit with, Tamara about that inconsistency year to year. Well, now if we're in an additional position of needing more shelters because more people are pushed out of encampments into what, right? Like, what do we have? What does it mean to be in this position where year to year we're not sure if the funding will come through or it will come through at the degree that is needed? So if you could speak, I'll start with you, Mayor Gloria, if you could speak about why a permanent source of ongoing funding is important to cities like San Diego, and then for Assemblymember Ward and Senator Blakespear, what are some legislative actions that can help secure that kind of continuous funding?
Sure. Well, let me just start by thanking both of these legislators for restoring HAP funding. The governor's proposed budget eliminated it, and that was terrifying to cities like San Diego and cities across the state. Some of you may know I chair the California Big City Mayors Coalition. It's 13 mayors of the largest cities in California, Republicans, Democrats, Independents, all working together largely on the issue of homelessness. And this became our most significant priority this budget year. And these legislators were always willing to take my call, respond to our pleas for that funding to be restored. And ultimately, they were successful. And this is a difficult budget year. The state was facing a significant budget deficit, and yet they made this a priority, which gives me hope that we can, even in the difficult times, really prioritize this issue. I will tell you the same thing is true at the city of San Diego. We're facing a $173 million budget deficit, roughly 9% needed to be cut out of our budget, significant. This year's budget has two plus-ups, one for homelessness, the other for infrastructure, roads, stormwater. That speaks to priorities. What is your priority? And in this case, you see clearly at the state level with the legislators, homelessness is a priority. I hope you see that as well with what we've done for the city. To answer your question, Dr. Nations, I would say that a permanent funding source would be tremendously helpful. The $1 billion that is HAP, and it's apportioned between counties, COCs, and cities, is helpful. But I will tell you that it is difficult to manage a program when you're living year to year. And I'll give you the best example I can give you on that. We've had a lot of discussions about land acquisitions and leases and whether or not things are good deals or not. Well, it's hard to drive your best deal if you're living year to year, right? If you can make a multi-year commitment to a program, a property, a vision, you can certainly get better return, right? You can get the certainty that, frankly, homeless individuals want, right? Often the client of services comes from the belief that they're not going to be there. They're not going to move into something if it's not going to continue. So I just, the ability to say with certainty year after year, we're going to have this resource that we can, yield as much efficiency out of this program as possible, that we have the ability to innovate. We can try new things knowing that if we're unsuccessful, we can, shuffle back and do something different next year. Instead, what we're doing is fighting for this on an annual basis, and it means a lot of our effort is focused on the fight and not necessarily on the implementation. It's not surprising that there's a lot of criticism from Sacramento about how cities are implementing. And I would simply argue that if we had the ability to take more of our mental and financial energy and put it towards implementation rather than fighting, I think we'd get more done. But at the end of the day, we got the resources we're looking for. That was not a fact in evidence at the beginning of this year, and I'm deeply grateful. I've promised the governor, I've promised these legislators, we will take this money and do good with it. I just believe we could do more good with it if it was on a permanent basis.
Yes. So I think we should definitely have HAP funding be ongoing, and we should commit to it. I mentioned this in the last panel. When it was proposed to be cut out by the governor, I strongly advocated against that, as did many, and including, of course, the housing chair on the assembly side. I think there was a unified approach from the mayors to the assembly members and the senators that was unacceptable. From my perspective, we should be saying that there's an ongoing source of funding, but we should also have a clear obligation for cities. So the mayor said that he is the chair of the 13 largest mayors, the cities in the state that are the largest in the state. And they, from my observation, are good actors, and that they are actually trying to do quite a lot when it comes to homelessness, because homelessness really largely has been located in their cities for a long time. And you see it's particularly bad in Sacramento, actually, which is a state capital. I think state capitals generally do have a higher homeless populations. But there are more than 400 cities in the entire state. So that means a lot of cities who actually want nothing to do with the solutions, because their constituents aren't interested in that, and they would rather have those people dealt with somewhere else over there. So, and this is something that was implicated in the prior question as well. But so from my perspective, we at the state level should be much more prescriptive with cities. And we should say, you have an obligation to provide homeless serving housing. It shouldn't be optional, because right now the money that cities get, they don't have to meet any type of unit requirement, like that's tied to the point in time count, or that provides services for a certain number of people, or that moves people from encampments into shelter, or we don't really have any obligations. And I know that cities, by and large, would not like this. So the League of Cities would be opposed to more obligations. But we really have seen an increase in affordable housing being built because of the obligations of what's called RHNA, the Regional Housing Needs Assessment process, which requires affordable housing to be zoned for. So if we actually had some requirements around homeless serving housing, I think that went along with this money, we would be faster solving the problem. But right now, it remains discretionary for many cities who aren't choosing to do anything.
Yeah, so where do I start? It was a very frustrating winter, and we were able to find solutions through early action and able to sort of soften that budget deficit, and then eventually, land in a place where we were able to restore a lot of those proposed cuts. But let me tell you, just the threat of those cuts, and certainly the alarm that we saw in the January draft, not only was I beside myself, but it really had real-time impact on the services and programs and even housing construction that was out there. When we heard and had testimony in February from counties that were coming up, regions like Sandag, right? Regional bodies that were saying, just like even the threat, the clawback of existing REAP dollars that were appropriated in last year's budget. But for a lot of reasons, the governor sort of had a blanket, if it wasn't out the door, then we were going to put a hold on that money. That stopped projects. And, when we're doing any kind of funding and you're trying to line up that funding and kind of get ready to go, I'll tell you, it does take, a little bit of time to be able to line up all those dots and then hit the green light on a given project. But it certainly stops on a dime the moment that you're threatened that something is going to be taken away. Very disruptive, I think, to even the ongoing work that was already in motion. So I'm glad we sort of were able to correct course on some of that, but some damage was done. To kind of jump to the end, of course, we absolutely need ongoing funding streams, and we've been talking about that, really banging that drum, because you have to predict better at the local level on both housing development especially, but also on programs and services that you're going to know that the resources are going to be there. We have a big problem, a lot of people experiencing homelessness that we need to solve, and we know we're going to be able to have to solve that over a multi-year time frame. But the idea that you can't guarantee that money's going to be there year after year after year, and then the threats like we saw this year might materialize, gives any organization or any local government pause about whether or not they should make certain commitments. So it's not helpful for ramping up our resources to be able to meet the problem, the scale of what we have in the moment. And we certainly appreciate that, have been reflecting those local voices through our work as legislators. on the HAP programs, we're not doing enough as it is. We heard often about how, your budget should be a reflection of your priorities. So again, it was just, beside myself thinking about why we were proposing to zero out not just these service dollars, but also housing construction dollars, right? That was sort of our first go-to, or actually the governor's draft go-to. I'm glad, again, we fought hard and we were able to restore a lot of that. Now, I know in fairness that we had a big problem to solve. And a lot of our budget is, for more or less, expected to be something that's kind of fixed. There are ongoing expenses in some areas of funding. We know we have statutorily or constitutionally locked in funding for education, for public safety, for some other areas, and that leaves us less and less to work with. So when you have that deficit, things that we have only recently, and in recent years, been able to start to allocate into our budget and hold the line, thanks to Mayor Gloria when he was my predecessor, one of the biggest champions to get HAP going in the first place, right? And in good times, able to maybe, consistently be able to allocate that $1 billion a year. And that becomes an expectation, except when the floor falls out, right? Something's got to give. And so you're looking back on sort of what was the most recently funded things, and you almost kind of consider them discretionary. And it was just, I think, a bad place to start from. So we are going to be looking for new solutions as we head into next year's budget. If all things go well and sort of the economic factors sort of stay constant, we believe that next year's state budget problems should be less than we were having to go through this year, because we dealt with some of the more difficult things this year. But I will continue to be able to fight to make sure that, one, we have that ongoing level of funding to at least try to be able to sustain the level of services we have, if not more, that we're able to deliver on. And two, that we don't do more damage, that we don't start from a starting point where threats are made, and that we're trying to have to claw back something to at least maintain the status quo.
Thank you. I want to shift us to talk about prevention and housing. So solving homelessness, of course, requires that we look beyond kind of management and containment toward prevention. So homelessness prevention programs, when they're targeted appropriately, can reduce that inflow that was brought up earlier into homelessness. And they're sometimes more cost-effective than other methods. So for Mayor Gloria, I hoped you could talk about what your vision is for how prevention fits into the city's strategy around homelessness. And then for the senator and assembly member, if you could talk about what levers are available to the state to incentivize more prevention work. So I'm thinking specifically about HAP as one example, where there's flexibility in how a city can spend that money. Are there things the state can do to help cities move toward prevention?
So prevention should be a significant part of any comprehensive response to homelessness, right? It's far preferable to keep someone from ending up on the streets, and it's certainly cheaper and more timely, right? When someone's on the streets, the system has failed, and getting them off the streets becomes infinitely more expensive and often takes too long, right? So the prevention piece is something that we've trained our eye on with a great deal of credit towards our council president, who this is a passion subject for him, and as a consequence, the city is getting more involved in this space. Let me just be very clear. The best prevention is building more housing, right? When you get that eviction notice, if you have the options of, you have a place you could possibly go to in a functional housing economy, that's what would work, right? And so part of our pro-housing stances and things like the Blueprint initiative that was adopted by the City Council yesterday, this is all homelessness prevention work. It also helps working middle class folks, which is fantastic, right? But just to be clear, when we're talking prevention, in my mind, build more housing. Give someone who gets that eviction notice, loses that job, the opportunity to move to something that may work better for them. So there's that. Beyond that, yes, there can be shallow subsidies. There can be things like what the Tamara at the COC provides in terms of security deposits and other things that is just that little bit to help. Our housing commission, Lisa Jones, I believe, is here, who did an exceptional job during the course of the pandemic when we were resourced to provide prevention resources. Our city, and I would tell you that the federal administration called us up and said, "What is going on in San Diego? You guys are killing it. These other cities are straggling and having difficulties getting this money out the door." We were not that, and I took that opportunity to say, "Well, whatever another city's not using, send it to me. We'll put it to work." And that's what Lisa and the team at the commission did. So we have begun to get into this space over the last 2-3 years. We're now working with philanthropic partners and other folks to work on targeted populations. And I think there is a world where that's going to work well. If you're a senior on a fixed income and you get a rent increase that you cannot absorb, a shallow subsidy that is permanent in nature, can get you, make sure that person doesn't end up on the streets. Is it a cure-all? Will it work for everybody? No. There is underlying mental illness and other issues that really require more significant interventions. We should probably talk about that this afternoon. But on the whole, we are looking more in this direction. We're taking some tentative steps in that place, and with the partnership with the Commission and the COC, I hope to see more work in this space. Again, a reminder, I only speak on behalf of 1/18 of all the cities in our county, and the question would be, what are those other cities doing?
Yeah, to the question of the shallow subsidies or prevention, keeping people from falling into homelessness, there's no question that is critical, because once somebody becomes homeless, they obviously their life has fallen apart, and also they're much harder to get back into shelter. So it's much more effective to keep people housed. I think one of the points of the audit, when it was looking at the state funding and also the 2 cities, was to say which programs are working. And so if the city is running programs, all the cities, not just the City of San Diego, but any of the cities in the state are running programs that do provide subsidies for people to stay housed and focusing on prevention, we need to have the data that shows that that's working, and then it allows state legislators like us to then fund those programs with more money based on data. So, that's all the point of the accountability, and what the audit was getting at was we just need better data, and we need the state and the cities to collect that and to document it and to have it consistent so that we are able to use it to drive what do we invest in. Because really at the end, what the state is doing is we are providing money for programs that are run by other entities, whether they're cities or nonprofits. And so seeing that something like that is really working, which intuitively seems like it would, is a really critical part. The other thing I'll just share is that I think it's important that we continue to focus on building the supply. The City of San Diego, the data that's recently come out about the great increase in the number of units permitted in the last year shows that there's been a real focus that's been effective. But, I think about I always think about this, the idea that homelessness is like people who, when the music stops, you have to find a chair to sit in, and there aren't enough chairs to sit in, so people are left standing, or they sit on the ground, or they sit on someone else's lap, or they sit on half a chair. These things where there just aren't enough chairs when the music stops. And I was having a conversation with Omar about this, and the point is that the music, if you keep people all in the chairs, then there's no movement. So in some ways, having prevention, having people stay in their house means that there aren't openings for other people. But the point is that we're trying to provide more chairs at the same time that we want people still sitting in a chair and not falling to the ground. So if we can keep people housed, it's much better, and all the programs that support that, I think we should be investing more in.
Yeah, just really underscoring my support as well for the prevention side of the solutions mix. Look, more people are falling into homelessness than are getting out, and that is true as today as it was 27 months ago. The Regional Task Force on the Homeless locally has been documenting that, and so we know that it is a cost-effective way to at least stop the growth while we are working to be able to resolve the more complex and more expensive solutions for those who are experiencing homelessness, the range of individuals that are out there. One of the things that really grabbed my attention, and I'm really proud to reflect on here, is an organization called All Home, which is sort of a umbrella organization for supporting 9 counties in the Bay Area that have done a real critical deep dive into a lot of their own data about what sort of best practices are. It's been an open-ended question. Yes, all these things are helpful. We have done rental subsidies, especially with the federal assistance we had during the pandemic, and we want to continue to do those. We have legislation to try to replicate that program and be able to fund that program for people that are in need of rental assistance. One of the things that was on the chopping block that we had was threatened to be cut, we restored it fully, was a program that helped foster youth that really had no other way to be able to keep themselves housed as they were sort of in transitional age up to age of 24. They wanted to zero that out when we knew that over the last 4 years it helped 1,300 young adults stay housed and be at least able to get on 2 solid feet. We know that emergency rental assistance, rapid rehousing programs are critical. So if somebody just lost their home, it's a lot more cost effective to get them stabilized and back into their home without a wider range of complement of social services to really keep them successfully housed. But All Home, this organization up in the Bay Area, had done an analysis from all of the programs that were up there, and really came down to something that was an interesting place to start a conversation about how much it would be funding in all these different buckets. And they are sort of working on a theory right now about a 1 to 2 to 4 ratio, where these are client served, not necessarily dollars, but you have about 1 unit of interim housing to 2 units of permanent supportive housing to 4 units of prevention, right? And that should at least help to stabilize and start to bring down the total number of homelessness they have in their responsible area, to be able to see those outcomes that we all hope to see here. We want to see homelessness go down. And if that's a really good guiding metric, again, prevention being key, we need to do more to make sure that the outcomes, and they're probably more cost-effective outcomes, are helping more people resolve homelessness before it even begins. And from there, we can kind of work on, again, yes, more housing supply, more interim solutions that are going to be able to help to work with the existing population, and we should be able to see progress.
All right, thank you. So since you all said housing, I had some housing questions for you. And I actually have a different question for each of you. Okay. So I'll again start with Mayor Gloria. Back to what Senator Blakespear said just a minute ago, the city has made land use changes, policy changes that have led to a significant boost in new housing supply being built. And with a portion of that, about 1/4, is my understanding, designated as affordable. So how do you see this new housing impacting homelessness in the city, and will these new units support those most vulnerable to homelessness? Like, how do we kind of make sure that connection stays there?
The short answer is yes, or unquestionably it does. And the way I choose to think of, Catherine had the musical chairs analogy, I think of housing as a ladder. And the fact is that we removed a lot of rungs on the ladder over the last, certainly over the course of my lifetime. I would tell you, when I was born, San Diego was about 700,000 people, and we were permitting about 15,000 homes per year. Fast forward to today, in recent history, we are double in size. We're 1.4 million people, but we've been averaging about 5,000 homes per year. If you double your population while reducing your housing production by 2/3, no wonder you have a homelessness crisis, a housing affordability crisis. And so we have to increase production. Last year, we hit 10,000 homes, the first time in a very long time. But we need to be at 15,000. So we have a ways to go, but I like the trend line that we're starting to see. Why does it accrue to the benefit of the most vulnerable and those who are currently unhoused? Because we're building rungs in the ladder. And so when you have a worker, and I'll just share my own situation. I'm the mayor of the city, but I'm a renter, right? That probably comes as a surprise to some of you all. But if you weren't born about when I did, the housing started to get too expensive, and if you got student loans and other things, you're just not getting there, right? So I'm probably occupying a unit that someone who has the job that isn't mayor maybe would want to be in, right? And that upward trajectory just is not happening. So as we pass the policies to create the rungs, to get the upward mobility, to create a functional housing economy, everyone benefits. Because the folks who are currently off the ladder, the unhoused, can climb onto that first rung of shelter or a single room occupancy hotel or a subsidized unit of some kind. And as you mentioned, we're not just building more housing, but we're diversifying. Are we having an overrepresentation on the market end? Yeah, of course, because that's where the money is to be made. But the policies that we've put in place to say that if you want to build more units, you must make them affordable, that we have inclusionary housing policies, commercial linkage fees, a number of things that really force the production of those units. Not enough, but certainly more. So we're going to continue on this trajectory, and under the belief that if there's more options, if housing is not a rare jewel, scarcity breeds cost, right? There aren't a lot of diamonds around, so therefore they're expensive. Well, housing shouldn't be like precious jewels, right? It should be plentiful. It is currently not plentiful, and so the cost is a lot. Our strategy is to make it more plentiful, the costs will come down, and literally everyone will benefit, including, I think a lot about the students on this campus, people whose lives we invest in, we subsidize their educations, we welcome them, we celebrate them, we hand them a diploma, and then we show them the door because we're not willing to make a space for them. That is not a strategy for long-term success for our region. We have to build housing, and again, when we house the students here, we will invariably create upward trajectory that will make space for other folks who are currently on our streets or who are living in substandard conditions.
Sorry to be really technical, but so for the housing that's being built and we have a portion of it that's affordable, what is the actual sort of accountability, or how do we ensure that developers are indeed renting those particular units to people under a certain income threshold?
So her name is Lisa Jones, and she is the CEO of our San Diego Housing Commission, and they have the accountability. So when these units are created, they're deed restricted. Right? So there's a legal encumbrance upon the property to operate in a certain format, to rent to a certain population, generally by income, but it could be other things, veteran, senior, et cetera. The accountability that Lisa and her team provide in terms of audits and inspections is intended to get to that. And so that's where it comes from. But it's also on the front end with our permitting department. You don't get that number of units per acre unless they're deed restricted. So there's a lot of checks and balances in it. It probably doesn't feel like much. You're like, Gloria's talking about all this housing, but I don't feel it. My rent went up this year. Well, you cannot solve a multi-generational challenge, 40 years of underproduction in 1 year of housing production, right? We're going to have to sustain this for some time. And a reminder, again, the city of San Diego cannot solve our county or our state's housing crisis all by itself. Everyone needs to be doing it. It's just my sincere hope that what we're doing is going to be replicated by others. And thanks to these two legislators, some of the legislation and the ordinances that we've passed at the local level have been introduced and passed at the state level in order to make sure that other jurisdictions do their part as well.
I've been given official permission to go over time because we started a little bit late. So if you have to take off at 12, you'll miss some real exciting stuff that's going to happen up until 12:10. But my next question is about, our region has really struggled to produce sufficient local funding to support construction of affordable and permanent supportive housing at the scale needed to move people out of homelessness and into a home. So what can be done, what needs to be done to increase our region's ability to compete for state tax incentives to build permanent supportive and affordable housing here?
Yeah, well, having a local source of funding for housing, and particularly homeless serving housing, is something that would tremendously benefit the county. I mean, any revenue stream is going to need to go to the voters. And so we collectively as a county need to say, we're willing to pass a sales tax or a parcel tax or a transfer tax or whatever the mechanism is, or a bond. And I think that when you look at funding streams, most money is coming through the state. Most money is not coming from the locals, but some cities do have local revenue streams, like I think San Jose does, and that really helps them because they're able to have matches. They can get more money from their local dollars, and also they're able to have ongoing streams, and they're able to pivot more quickly because they have a stream of money that they can devote to the most urgent need. So to me, this is something that we do need in San Diego. There are many things we need in San Diego County, and we need transportation improvements, and we need to fight climate change, and we need to fix our roads, and so and our stormwater. So this is one of the top priorities, and I do hope that we come to the consensus that it's something that we do want to have a local stream of revenue for.
Assemblymember Ward, do we need a finance authority?
Well, back in the year 2020, I actually had a bond measure for the city that would have been around $900 million when it was fully appropriated, that we had estimated would support 7,500 units of affordable housing, deeply low income housing, that literally today in 2024 would be underway, if not already doors open, right? The clear majority of voters, 57% of San Diego voters said yes. It just wasn't enough when we're sort of stymied with a 2/3 vote threshold. So we know that there's a lot of will there. Quick plug, I'm grateful for the city's council's leadership and the mayor's support to be able to support the sales tax measure that can go out there. And although that's a general tax, we have a lot of general needs, and that is not exclusive of possibly funding additional homeless and supportive services. I think to the tune of $400 million a year. That's a lot to start to be able to elevate all of our priorities that we need here in the city. So take a critical look at that. So I'm very supportive of that. Yes, it does help us qualify for additional funding at both state and federal level, and we had that match. Hopefully also attracts more private philanthropy when they know that government is in. I think there's a little bit more willingness as well for private dollars to come in and be able to match that, and that amplifies the impact that you're going to have. But we are solving, I think, our housing crisis, sort of twofold. Yes, you're always going to need some public resource to be able to help support some of that deeply affordable subsidy that we need to be able to produce the units for those that are of extremely low income. But we've got to do more on housing supply in general, because it does help to actually stabilize the total costs of the market and ultimately what the rental prices are out there. And we're seeing that today, maybe even anecdotally in some of our neighborhoods. I think that I've seen North Park rents start to decline a little bit. We've had a lot of development there along El Cajon Boulevard, a lot of doors that are opening. Those new units that are going in there are competitive, and if people are able to move into those, that frees up another unit, which over time becomes that naturally occurring affordable housing that is going to be a little bit more at or below market level. So total supply also matters. It's going to help for the middle income housing that we desperately need. I've got some other pieces of legislation and work to particularly support middle income housing development, but it's the totality of all of these solutions that really are going to add up. We are never going to, nor should we, buy our way out of trying to fully subsidize all the housing that's needed, but the market has a long way to be able to play in the total solutions that sort of make the economics work out for everybody.
So we also have Proposition 1 that the voters of California recently passed, which is making millions of dollars available for local governments to build behavioral health supports, including housing. And what can our region do to be prepared to benefit from this revenue source? Is it influencing your strategies at the state legislature?
Well, our county, our COC, definitely want to kind of study how to best qualify us for that. And yes, the governor just released, I think, the first $3.3 billion of resources that are going to be available to compete. So kind of meeting, the competitive points that are on there. And I believe San Diego is well positioned to be able to do that. So long as that, we are a pro-housing city. We are showing that we have our policies in motion. And I think that's something that can be rewarded. We have a willingness, and I want to thank county leadership as well. When thinking back to, their support to be one of the first care court systems that showed an interest here to be able to do more, to be creative, to be transformative with our county resources. And I think all this is to say the local political will is there to try to meet the moment and do something different to be in a better position to be able to qualify for these monies that are now coming, that are now up for play.
If I can just tag on for that. So it's been reported, the city council recently at my request updated our land development code to help streamline behavioral health facility permitting in the city of San Diego. We often lack resources, so Prop 1 is helpful because it'll create resources, but then whether or not there's the will to actually create these facilities, you might imagine new housing is controversial. When you're talking about new housing for the severely mentally ill or substance use disorder folks, that becomes even more difficult. Our land development code update is intended to help us be more competitive for Prop 1 funds. As maybe you've already picked up, I'm a little competitive, and if there's money to be had and we have to compete for it, I'm going to do everything we can so that San Diego is in a prime position to bring down those dollars the voters authorized. The challenge, of course, is making sure we identify those locations. We work with the county to support some of these facilities. We've talked a lot about homeless folks here and the housing need in general. We don't talk nearly enough. I think it's our social stigma against mental health and substance use. We don't talk nearly enough about the need for detox beds, the need for behavioral health treatment facilities, institutions that can better serve these individuals. We have to acknowledge that some of the folks that we're most troubled by when we see them encamped in the public right-of-way are folks who are not necessarily suitable placements in a traditional shelter. We've tried our best to create new shelters that do a variety of things, but one of which is to work with the behavioral health needs community. But at the end of the day, what we need is a more robust offering, and this is a part of why myself and my fellow mayors were so strongly supportive of Proposition 1, because we recognize that the shelters we're providing are not adequate for this need, and that we need to have a dedicated funding source that can provide for those very specialized beds for this very vulnerable part of our population.
Did you want to add anything about Proposition 1?
Just briefly, that the $3.3 billion that is now available for these beds is so important. I mean, that together with Care Court, which the Care Court or the care system, unfortunately, seems like it's going to be serving a lot fewer people than I think some of us hoped. When we had a report on this in the state Senate, and Each county it's very small, the number of people, but people who have really severe mental health needs, that we need to have places for them to seek treatment. I mean, that's clearly needs to be part of the solution. So I was very grateful that Prop 1 passed, barely by the skin of its teeth, but at least it did. And now this money is available, and hopefully it is coming to San Diego because we positioned ourselves to be able to apply for it.
Thank you. I'm trying to multitask here with audience questions, and I don't think I'm doing a great job of it. But I do want to bring up a theme in one of these questions, which is about racial equity. And I'm going to tie it into the last question I had, which is about short-term and long-term strategies and pressures. So, we of course know that our homelessness crisis is decades in the making, that it doesn't just reflect housing, it also reflects racially discriminatory practices in employment and housing that have unfolded over 100 years. So maybe if you could speak to the way that you in the legislature, in the city, approach racial disparity, in particular the overrepresentation of Black and Indigenous folks experiencing homelessness.
I mean, this is very similar to previous situation. I mean, you have something that has been around forever, and that's not an excuse to not act, quite the opposite. It's just a recognition of how slow this work will be. But I know that our Continuum of Care issued a plan for addressing Black homelessness, which I think is the first step to identifying there is a disparity. How do you plan to address it, and how do you go about doing it? I know the audit and the Housing Commission have looked at the ban lists for our existing shelters when a resident is not permitted to return. We see an overrepresentation that's there, and working with our providers to try and understand why is that, and is that implicit bias, and what are the reasons behind it. Many of you know that we have an Office of Race and Equity at the City of San Diego now. It's not just internally faced to make sure our employees are trained to be able to better serve a diverse city, but also externally faced about what are the programs we're putting out there and what are the disparities that are there. And you can see the fruits of that work in the Blueprint SD proposal that was approved by the City Council yesterday. It is a general plan update. It is by nature a land use document, but in it is a contemplation for how we address the racial segregation that has been brought to us by historic redlining and the kinds of things that I think are behind those questions. So we grapple with this issue, and it's one where there's not a magic solution to it, but whether it's the plan the COC has, the auditing that the state and the Housing Commission is doing to this general plan that really speaks to this exact very issue. We know that past planning resulted in racial inequities that concentrated Black and brown people in the precise neighborhoods that were flooded back in January. When we know that that was the outcome of it, it seemed like the right venue to try to address it in a 2024 document to say we're going to be intentional about trying to address these inequities. But this is a significant challenge, and we're trying to do this work now, but a lot of it's going to take a lot of time.
Yeah, and I'll just add that if my memory serves me, it's just less than 15% of the state is Black or African American. So just less than 15%, but 40% of the homeless population is Black or African American, 40%. So we see this dramatic difference, and it's really a reflection of the societal failures of our social safety net and our economic system. And, the reality of redlining and a number of different discriminatory housing and jobs policies are the result of intentional segregation from previous decades. So to me, that means we need to intentionally desegregate. So, and that is what is happening at the City of San Diego through the policies that they're passing. It's a recognition that we need to be intentional with our desire and our commitment to change these historic wrongs. So homelessness, it is really important that we talk about it in terms that recognize the racial differences and also that commitment to change it. Because otherwise, it's not just going to happen on its own. We need that intentionality behind it.
Yeah, and I'll really underscore that too and reflect that, in San Diego, 6% of our population, general population, being African American, 24% or so of the homeless population being African American. So the disparities are, particularly acute here in San Diego. And I think it also reminds us again that a lot of the problems that we have around homelessness generally are rooted in economics, right? And the tie to economic injustice that we have, the earnings potential, poverty, other things that have historically continued to be able to challenge our African American population. So for the policies that we are doing right now to be able to support the correction and closing the gap, I think of a lot of those poverty-based or economic-based disparities that we have will over time be able to at least help more individuals with earning potential be able to meet the moment of what we're seeing around rent, which is ultimately the biggest driver of homelessness that we have. And then I would, sort of ask in the interim, and maybe that's a challenge for us, is to think about, the ways that we can, within the bounds of the law, also particularly work with churches, community-based organizations, or others that are willing to say yes and are willing to try to, strategize and be ready to compete for a lot of the grant support that is needed to be able to support the population that they also do at the community level. So that's something perhaps that we continue to work on with our COC about strategies that can improve that in the interim while we work on these long-standing and unacceptable areas of inequity and drivers.
Thank you. As kind of a wrap-up question, I want to, and I think this represents some of the questions that I have up here. I'm hoping you can reflect a bit on the tension in your job with short-term and long-term demands. So, of course, you all face re-election cycles, and there are solutions maybe you feel pressured to pursue that are a shorter-term, perhaps more visible way to address homelessness. And then there's, of course, we just talked about, this is a long-standing issue. It's a long time in the making, and it's a slow work in a lot of ways. And that type of action, whether in a budgetary context or, a legislative, city policy context, requires, forethought, looking into the future, peering into the glass ball, but also, making policies that we might not see the effects of for a long time to come. So if you could just kind of talk about how do you think about that, and how do you juggle the pressure to make a change that someone walking down the street can see right now, like at an encampment clearance, versus that hard work to build something that someone can move into that has behavioral health supports 10 years from now. And we can just start with Mayor Gloria.
Well, I mean, that's kind of the crux of the issue, and it's not so much about timing for me, but it's about consistency. I think you all can appreciate that the more common part of my day is people who are very angry about homelessness while simultaneously being opposed to new housing and the construction of shelters in their community. Those observation, that sort of hypocritical position is always presented to me without any kind of sense of irony about when that's said. I saw it the other day on the news when some folks out in East County successfully blocked a new tiny home village, and gentleman was asked by the reporter, so what do you think about that? And his answer was, that's great, I didn't want that here, but they really should do something about homelessness. Make it make sense. I can't make sense of it. So I guess my answer to that is that I know what I'm here to do. I'm here to build more housing, to make sure that from the unsheltered individual to the new student to the senior citizen to the couple who's aspiring to buy a home, build wealth, and raise a family has a fighting chance in our city. And I do that as the son of a hotel maid and a gardener. My parents worked their fingers to the bone to give my brother and I an opportunity to stay in our hometown, and they were successful. They bought a home in San Diego a long time ago. They were able to do that as working class people. I think we all recognize that today that story is not replicable, and I refuse to accept that as status quo. I'm doing everything I possibly can to short circuit that. And so when I get those kinds of comments, I don't mind calling it out as the nonsense that it is. I had a woman hollering at me at the Pride Parade on Saturday. She didn't know what she started because she was hollering at me about she didn't want housing. She was admittedly, we're on 6th Avenue. There's a lot of housing going on, new housing being constructed. And I just like, no, the rent's too high. We have to do this. And how are you at a pride parade for espousing that folks, are welcome here and everyone is welcome and we love everybody, only if you can afford the rent though, right? If you're a trans kid in some state that just doesn't love you very much, you're welcome to come to San Diego. We will give you legal protections, but we won't give you a home. Make that make sense. So I don't feel particular pressure any kind of way because I'm resolute with what I'm trying to do. And I'm trying to do it on both ends. If any politician tells you they can't do multiple things at once, you let them know that you have to be a good spouse, a good parent, a good worker, a good boss. You're asked to do multiple things at once. You should expect that of us. So yes, I will construct shelters. At the same time, I build more affordable housing. People often try and say you have to choose between one or the other. No, I don't. I have to do both. Because I'm not going to tell someone who's on the street that they need to wait 2, 3, 4, 5 years till we can build that unit and just hang on. Let me know how I'll see you in about a half a decade. Unacceptable. We should build opportunities for people to get off the streets immediately while simultaneously, because we can multitask, to build the housing that they can afford and will keep them sustained. We have done this historically. We've been housing ourselves as a species for millennia. This is possible. We just have to have the courage and the will and the resoluteness to come back again and again so that when they shut down a shelter here, okay, I got 3 other ideas. Here, choose one of these. That's what you're going to get from me as mayor. And I do that knowing that in 1988, Mayor Maureen O'Connor famously spent 2 nights sleeping on the streets of San Diego because the homeless crisis was so acute that she wanted to go see it for herself. 1988. Here we are in 2024. The situation is just the same. We've been doing the same thing over and over again, assuming that we can keep housing production low and that everything will be fine. What we're doing differently is saying, no, it is the housing and we need to build it. And we're going to go work with our state legislators to get resources. We're going to pass changing blueprints and policies. And then we're going to manage the organization. As your mayor, as strong mayor, I've told permitting staff they have to permit affordable housing complexes in 30 days or less.
Okay.
They didn't think it was possible, but they're now doing it in 9 days. That's what we're bringing to this issue. I hope to be able to drive change, but I can't do it a generation's worth of work in one administration. But I want to set a template here in San Diego that's replicable across our state and across our country. And I thank you for giving me the opportunity to do this work.
Okay. Re-election speech right there.
Thank you. And I just want to say a big thank you to both of the gentlemen on my left and right they both have represented San Diego at the state level and at the local level on the city council and in the legislature and really bring a wealth of experience to this topic. And I'm so grateful that you were both able to come to this summit and share your wisdom and your insights with the crowd. So thank you very much. So to me, the tension, I don't have a tension between a short-term and a long-term solution. I feel like the tension, which goes to some of the comments that the mayor just made, really is about this siting issue. The way that we have set up our whole system of where do we put the solutions devolves into decision-making by those who experience the burdens of something and don't feel like the benefits that are diffused really come back to them. And so I think a lot about how can we structurally change things so that the locus of that tension is not sitting right there, and it's very difficult to change. So, and that's because cities have land use authority, counties and the state don't, and how do we build and what do we build? And most housing still is market rate housing. Most housing is not basically public housing. So I think about the societies that don't seem to have a homelessness problem, like places in Europe, and the amount of money they're putting into it, but also the public housing. It could be scattered site public housing, but basically it allows people to live inside no matter what their income is. And we have, I fear, the silver tsunami, the huge number of people on Social Security with no savings who are falling into homelessness, the baby boomers aging into seniority every year, and just seeing that this problem that we have is continuing to get worse. And we, in many ways, we're still tinkering around the edges. And I hope that the tinkering around the edges as a collective does actually make a difference. And I use as an example the things like Yes in God's Backyard, which was a bill that allows churches to build housing. And the UC is investing in housing. The city of San Diego, UCSD, has done a tremendous amount to build housing dormitories for students. So students aren't sucking up the housing for all the professionals that are around those UCs and the CSU system. So some of these, the big institutions and even the entire education system below that. So what about the school districts and them building housing for their teachers? What about cities building housing for their workers? So these are all incremental, but they could add up to be significant. And I think you hear that, the solutions from the mayor that he's talking about. And certainly there's no lack of focus on it. So I know that Assemblymember Ward thinks about this every day, and he's the chair of the Housing Committee and sees the bills that come through, and you heard from the other people on these panels. We definitely are focused on it, but there is a tension that, to me, that shows the tension is, are we really solving the problem? Are we going to be able to solve the problem? Because fundamentally, we should be able to. Like, there's just no reason that we should have the homeless populations that we have and see them continuing to get worse.
Yeah, and I'll just add, I know we're at time, but on the short-term, long-term conflict, has been around for a while. We just don't have all that we would want to work with to meet the demand that we have right now. So that's part of the tension right now, and we know that from all the programs that are being debated that we're trying to be able to fund, and they compete with each other. I'm remembering a state commission report from just about a year and a half ago from the Corporation for Supportive Housing that was looking at the totality of what we need to actually, if we had everything we wanted to work with, what would it take to solve homelessness and be able to build enough affordable housing here in California? Because we were doing about $1 billion a year. And they said, well, we would need about $8 billion a year over the next 10 years to be able to meet the demand that was out there for extremely low income housing. So that just showed you, we walked into this section, I saw a slide up here that said, we're spending more than we ever have and the problem's getting worse. So, and I hear this from my Republican colleagues as well. So their solution is to reduce spending when we know the data shows that we've never been doing enough all along to be able to meet the total demand that's out there right now. And meanwhile, we'll try to use our own data. This is my total pie to work with right now to at least try to ratio that in a way that supports both short-term, interim, and long-term solutions. On issues of siting, we, yes, have that tension, but I would leave you with this thought. One of my observations in the hot seat as a legislator right now, and time short that it is, we have a lot to work on in the time that we're giving under term limits, is that, the status quo really drives you to kill things, right? Especially a lot of the bureaucracy, they want to get to no, right? But I'm elected to get to yes. I'm elected to be able to actually think about things that maybe hopefully have enough support, at least theoretically under there, to launch a new idea, to try something different. And if I'm wrong, right? But at least we're trying something else. In my time on city council, the crisis as big as it was, the Hep A crisis, that was hitting our streets, we said, you know what? We've got to get people off of our streets. It's disgusting. We've got to try something different. Let's try a safe campground. Golden Hill went nuts, rightfully, because they'd never seen something like this before. And what are you going to do? Is this going to affect us? And we almost overprescribed, the amount of security, the resources that were there. There wasn't a single problem in the neighborhood, right? We cleaned up that immediate surrounding area, and then we were able to work on other models now that was replicated again back at 20th and B, and again now at OLOT. And when we think about, the work that you've done up in Encinitas too, the safe campground that you were able to, the backlash that you were able to get, you had no problems from clients that were up there right now. You had problems from a few neighbors that were flying drones over, right? Trying to be able actually to infringe upon these people that just wanted a safe place to be. So I feel that the more that we are showcasing these examples that are working, that are starting to actually program and get people towards positive outcomes, and that there are never any neighborhood impacts, is going to be able to give us those case studies. When we think about permanent supportive housing, I think back to Talmadge Commons, right? Because, when we're talking about that in the other neighborhoods and they just don't know what this is, but you can go, do you want to take a tour of this place? Do you want to see that the immediate surrounding environment, it's not attracting drug dealers. It's not actually like, a scourge on the neighborhood. It looks great and it looks just like everything else that's around there. And so, yes, we need more of that. So my motivation is to think about vision that gets us to yes, convince my colleagues that that's the right thing to do. Listen to neighbors always. Really try to, make sure that you're accessible and responsive and that you're hearing those concerns, and are those concerns actually responded to in the programs or the policies that you're developing, and in the follow-through and the implementation that comes out there. And I think that we're going to see more success stories if we really try to encourage more colleagues, more legislators, more council members to be willing to say yes as well.
Thank you. Sorry for holding you even longer. Thank you so much to our panelists. And I'll just hand it to Senator Blakespear to finish up.
All right, thank you, everybody. Have a great rest of your day. Thank you for coming. Thank you to the panelists.